Chile, the vice chair. Those online, thank you for joining us again. It's been good to have you in company. And we start this morning with the summary of yesterday's session. And to give us that summary is Jimena Kolowski, Demand Reduction Unit Chief, CICAD Executive Secretariat. Ms. Kolowski, over to you.
Muchas gracias, muy buenos días. Bueno, ayer tuvimos un día muy interesante y una
Morning,
noche
yesterday we had a
también
very interesting day, and last night we also had an interesting day. Those of you who missed it, you missed a good time. We had a very interesting day where we touched on topics that are very relevant in our region. We started in the morning with the panel on the impact of trauma and stress and chronic stress, and then with disorders with our star moderator. And mainly we saw 4 presentations which gave us knowledge of different aspects of the topic of trauma and of trauma. We started with a presentation on stress, survival, and based on the information on trauma, high-risk communities, in charge of Mr. Phillips, funder and clinical director here in Barbados. And some of the relevant points is that the communities of high risk very often encounter several stressful factors throughout their lives, or in most important, vital life cycles. There's a question which is what is prevention based on trauma? We had the key principles of the work based on trauma, and finally the presentation was closed with a very relevant idea is that if people need support and not punishment, and the prevention should be considered the history and the identity of the person. The framework based on trauma generate confidence and curing and healing. We also had a presentation by Jessica Rolanios, who was our expert consultant of the Latin American Federation of the Therapeutic Community with regard to the trauma. Some of the definition of trauma which she mentioned was given, and then we went back to some of the models, how to generate a culture of security in the programs. We talked about psychoeducation, working on the strengthening the framework and some clinical consideration. We also had the presentation from El Salvador of Gloria Marina Salinas de Torres on psychosocial trauma and drug consumption. She started with the question, what do we understand by psychosocial trauma? And then she developed the following key points. We still have a far distance over here. Trauma as a consequence of violation of human rights, which is something in several countries we have experienced at some point in time in our history. The consumption of drugs, the alternatives with the focus on the human rights, and also she asked another question, which she left as for closure: how can we avoid the continuance of reproducing the trauma that we want to heal? We also had a presentation from Mexico from Gerardo Peña Nieves, who spoke with us about trauma and chronic stress and disorders due to the consumption of substances. He spoke of what the trauma and chronic trauma and the neurobiological explanations, which was very clarifying on how this circuit functions at the cerebral level. It's very important based on given the neuroscience that had to be taken from them several years ago. what we knew as a phenomenon more that's more psychological. Now we know how it is. It has a it reflects the neurodevelopment, and also he spoke of some protection factors and prevention factors, and for conclusion, he's pointed out that childhood trauma can be probably an explanation for disorders due to consumption of drugs, uh, 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 and what community actions and family action and school action can be done to perhaps we can have to prevent this impact in the child development. We linked all that also with what we saw in the first day of the presentation of Dr. Aria Rossi, who spoke about this vectors of development of the brain. When we have when those which produce a development, accelerated development of the brain, and above that, we include it in traumatic events. This affects uh, that development. Then we did develop uh, 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 a very rich discussion with interventions and questions from Barbados, Antigua and Barbuda, in-house Guatemala, and online Trinidad and Tobago, except Grenada as well. After the coffee break, we had a presentation on the topic of vaping, which was very interesting also, and in fact, Ferdinand mentioned that he would like to see the evidence, how they have taken actions and decisions based on evidence. First, we had a presentation from Elizabeth Japal from Grenada, who started with the reasons for the use of electronic cigarettes in the Grenadian youth. She showed us the information and data that they have compiled, which are very interesting, and how the Grenadian youth perceive the risk for the health, and many erroneous ideas that exist in that framework. Not only Grenada, I must say, I think that perhaps as something exists in different countries regarding the security of smoking electronic cigarettes. Then we had the results of a survey and some key findings which have to do with the influence of the parents and the friends, the lack of participation of the parents as 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 a barrier, the difficulty not having adequate supervision over the children and adolescents of importance. In the conclusions, I should the school intervention with the intervention, which was a multi-level stage with different educational strategies, focus on key determinants depending on the group that we are working and based on evidence. We also had a presentation online from Atkinson, who's the director of research and development program of monitoring programs and evaluation of the National Council on the Abuse of Drugs, the Ministry of Health and Wellbeing of Jamaica. We started with the context and the preoccupations and the use of electronic cigarettes. We presented the components of this. The results were presented of rapid evaluation of the situation in Jamaica. We spoke of the conscience and the awareness and the risk, the access and exposure to that, and recommendations for prevention. He ended with the findings. We also had a space for a discussion, analysis, and question. And that's where we had the questions from Pernell, questions which were done by Trinidad and Tobago. Then we went on to the first part of the workshop of systemic focus of the regional systems, which was under the charge of the Vice Presidency of Chile, and the moderators were Francisco Ablitas and Carolina Bruce. They're going to give you on that and some results. And Francisco did a brief presentation on the resolution of the CND, the prevention systems, and the indications for group work, and the framework in which that workshop was developed has to do with the resolution of the CND. When we talk about the program, when we think about the program between Chile and Barbados, we said an option is to present a resolution, and another one is to give a space and time to reflect and discuss and what implications it has for our countries, having to rely on these solutions. Some results is that there's a high effect of the presentation, but there are some important gaps, like at the early childhood, in the adolescence, and for the elderly. The the and we touch specifically on alcohol. There's not other psychoactive substance and electronic cigarettes. We also mentioned the importance of stigma, uh, the interventions for pregnancy, and another environment prevention strategy. We spoke also about the gaps in some specific topics, such as the work through the communication media and the involvement of the youth in the design of the programs. We talked about some necessities, uh, train in-person training, and persons with disabilities, and some and others. And then in the evening, we continued with the collaborative work, and we started with the question of, if we know what we need, what can each country contribute? So we had some things to mention. We had to mention a few things with respect to Chile, Guatemala. Uh, Francisco Vicen's also mentioned. Those are the ones who place on the table uh, the contributions that they wanted to highlight in 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 this space, which reform can be. I don't know if you want to add anything else, if in case I have forgotten something. Anybody wants to make a comment on what was said yesterday?
Morning, everyone. Trust everyone had a good evening. Thank you very much for that concise and comprehensive overview of yesterday. And I think it's important, what's really come out is that one of the main objectives is not only capacity building, but to collaborate with each other. What I found really interesting is that even though we are in different countries, we are faced with very similar challenges. And therefore, today is really going to be how we can interrelate with each other, what plans and recommendations we can make going forward in terms of, and you would have mentioned, the youth prevention programs, looking at the programs for pregnant women, being gender specific, etc. We've had a wealth of information, and what we can observe is that many of us do have some key tools, but it's in actually collating them and collaborating with each other to ensure that we can move forward. We don't just want this to be a talk shop, right? We want it to be where we can leave here knowing that we are collaborating together, that we have some similarities. Yes, there are differences, but we have similarities that we combine together, especially at a time when resources are so limited. We really do need to have that transference of knowledge, training each other, and that really came out yesterday in the last workshop, and the willingness and the openness for us to say, you know what, let's work together and let's transfer some of that information from one country to another, because as Angela would have mentioned, we are one. Different, but we are one, so it's really important for this collaboration.
Thank you so much. Sí, creo que eso es muy importante.
Yes, I think that is very important, as the spirit of being one body, which was mentioned yesterday in a very beautiful space of collaboration, and that's the idea to continue today in the morning session, to keep this team functioning beyond the expert book, have that spirit of collaboration, which we keep more beyond between meetings and meetings beyond meetings. And thank you very much. I think that's more or less the summary of 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 yesterday. Thank you.
The review of yesterday's session. We go swiftly into our first workshop of the day, the collaborative work among countries in drug demand reduction, part 2, working groups, with our moderators, Francesca Oblitas, the vice chair of the Demand Reduction Experts Group, head of the Programming Division, National Service for the Prevention and Rehabilitation of Drug and Alcohol Consumption, Jimena Kalowski, the Demand Reduction Unit Chief at CICAD Executive Secretariat, and Alison Gotip, the Clinical Director, Verdun and Marina Houses, Barbados. Ladies, over to you for our first workshop of the day.
Buenos días. Ahora sí. Bueno. ¿Aló? ¿Sí?
Hello, you hearing me?
It's like God voice.
Good morning. We are going to begin today's work, which focuses on Samuel. Is it okay now? It's more dramatic when my voice is like this. Hello? Hello? Is it okay now? Testing? Okay. We are going to begin today's work, which in reality is to resume the discussion that we had since yesterday. I imagine that with the rest that you had and the reflection that you may have had during the end of yesterday's sessions and yesterday morning, I want to listen to these ideas, these countries. And Alison was point that this is the best reflection and learning that we had yesterday. It is time to collaborate amongst us, and it's time to strengthen our demand reduction with the capacities and the learnings that we've had among our countries. Yesterday, Jimena did a very good summary, but I want to bring together the ideas that we've had in terms of how we can continue our collaborative work amongst the different countries that make up CICAD. We had a first idea that was mentioned, which is a repository of tools, a space that we must define, whether it's a website, web page, a file on the cloud. But we need to store and share tools, interventions, programs, learning campaigns. So in fact, it will be a space where every country can share resources, things that have worked for them and things that have been good practices. Then we also mentioned the idea of having a catalog of programs, something that would be a bit more structured, where we could, apart from the form that we filled out for yesterday, we could include strategies for treatment, social integration, harm reduction, And this includes a brief description of the program, and we could also have a catalog with intervention where we could identify the gaps that we all mentioned. If we also looked at prevention systems among the countries. There are fewer. We had programs for pregnant women. We can share these programs. Of course, there are the interventions that were proposed by PAHO for early detection, interventions. So we need to be able to understand what exists, and therefore, in addition to that, we mentioned the idea of alliances, one with civil society, where Margarita Berga very generously just agreed to share the training that they had, the courses, etc. And then we also spoke about alliances among countries. We also had presentations by Colombia, Guatemala, Mexico, Chile, Barbados, Panama, Grenada. And they were willing to share the lessons that they've learned so that we could exchange what they've learned in better spaces so that we can go deeper into those issues. And we also talked about how we could create a system for transversal evaluations and collaborations among the countries, as well as consultation. These are the four main ideas that we've had so far. And now I'd like to hand over to you so that you can continue to tell us if you've had other ideas since then. If you remembered something, the persons who are online, can we see on the screen? Well, podemos ver las personas, podemos. We are therefore opening the floor to you. You can spend about, if 3 minutes go by and nobody raises their hand, we're going to ask our friend to do our brain exercises until somebody begins to start to talk. Hey, are you hearing me? Yes? Elisa? Hi, Francisco, everyone. How are you? I don't know if it's a new idea, but it seems we dealt with a number of issues, and the issue of the repository and the catalog that Francisca mentioned, it seems very important to me, given that when we are thinking of working in a new line, a new policy, we also go to our strategic partners and other countries to get ideas. So it would be very good to have something which is pre-constructed, which is well organized, so that we can have all of the initiatives within easy reach, so that they are available online. So I think that is an excellent idea. And in addition to, we were willing to share the programs that the Secretariat has. We have a number of initiatives with regard to prevention, detection. There are a number of issues that we could share materials on in terms of the areas in which we are worked, in the area of education, work. We have programs for certification for working the preventative programs in the workplace. So we have a number of programs that we can share, and we have work with young people. in different areas of work with families. And we also have community initiatives. We've been exploring, maybe we can work on everything to do with digital activity of young people and addictions online. So I think that is a very good idea to have the catalog and the repository, and we could see how we could have a number of meetings to go even further with this and to finalize everything. Thank you very much. Thank you, Elisa. Thank you, Elisa. I see Chile wants to speak. Carolina? Good morning to everyone. I think that we all agree in the idea of the catalog, which seems like a very good idea. And perhaps another issue that we can work on further, and we can establish how we will plan and the management and the annual work. We could have a system for work so that we could identify within this catalog initiatives and programs that are interesting to countries, and we could establish a system of alliances that will allow us to work constantly and permanently in transferring experience based on these programs. We could have the catalog available, identify in which level the countries are willing to assist, to have alliances and to exchange experiences. And we can plan this in a permanent way so that we can work on the long term, and we could work this could help us in our annual planning. And I think that this could be an alternative to sustain these meetings in the long term. And Chile is available to facilitate alliances that could help us to exchange experiences and to provide assistance in terms of programs, monitoring, and evaluation programs. Thank you, Carolina.
I think the entire initiative is a wonderful idea, especially for Barbados. Several of our programs are evidence informed. We do not really monitor and evaluate our programming, and it's important for us to understand how effective and efficient our programs are if we're achieving our objectives, our goals, through monitoring and evaluation. This is key for us as we seek to expand the reach of the NCSA locally and to develop our programs in a more strategic way. We have limited resources as an organization. We have around 6 to 8 persons working in our program team, inclusive of 4 what we call substance abuse prevention officers who are responsible for prevention, 2 research officers, thank you, 2 research officers and 2 counselors on board to basically facilitate drug demand reduction over the entire country, which is about over 280,000 persons. It's important for us to collaborate as a hemisphere, share ideas, brainstorm, see what works best for us as a hemisphere, see where we can adapt and adjust programs from Latin America, from as far as Jamaica, Bahamas, as it relates to the Eastern Caribbean, and see where they fit into our entire strategic plans as an organization, especially NCSA, while monitoring and evaluating these programs that we have implemented. For instance, 2 of my colleagues mentioned the Project SOLVE, which is 23 years old. Though we have some element of monitoring and evaluation as it relates to the actual program, the actual tracking of these persons over the 23 years and how effective the program was in a more research-based way, to see how effective and efficient that program was, to see if the program is actually working, where can we tweak it, in a way that it can be more productive, as well as the substance abuse prevention badge, where we're looking at the entire program, how effective it is, monitoring, evaluation, the person who received what I like to call the medication, which is a more controlled group against the experimental group, where persons that don't actually get the information, and how best we can go into the vulnerable communities, the at-risk communities, the communities on the fringes of mainstream society, and engage them in a way that they can receive our information to improve the output and to reduce the use of substance abuse disorders, especially across the Caribbean. So I'm interested, especially for Barbados, how Chile or any person around the table can assist us with our monitoring and evaluation going forward.
Interesante lo que nos planteas, Troy, de la evaluación. Y
What Troy has mentioned
pienso-
about evaluation is very interesting, and I think that we could perhaps also have alliances with the universities in our countries which have studies for research and are perhaps looking for spaces in which they could do in research, and perhaps a country could say, evaluate my program for ventures, and it would be interesting for the universities as well. So I think that it is something that we could examine in our countries and work with the research and the studies centers, and we can show them what we have as a region, and we could perhaps come back with another meeting in order to do some exchanges in terms of our research results with the university. Pernell?
Everyone, seems like we are in a situation where we are trying to find solutions and recommendations and concrete steps to move forward with the idea of collaboration. So I'm going to make a couple recommendations, and I'm also going to ask a couple questions. The idea of the inventory, I think, is excellent. I think it is important, number one, to document what you're doing, all right? So the inventory is good. What I would recommend further is that you organize this inventory in such a way that it is by population subgroup, for example, community programs, school-based programs. Make it searchable so that if I'm interested in what Chile is doing or Uruguay is doing, or the Bahamas or Barbados, in youth prevention, there's a database I can search to get some ideas about what they're doing. So this is taking the inventory, which is the first step, a little further to make it more useful for you as the prevention specialist. The other thing that I would recommend is following on from the ideas raised by Chile and Barbados about monitoring and evaluation, is to, and this, Francisca, you briefly mentioned to me yesterday, how can the observatories, the National Drug Observatories, help more in the area of prevention? I think case studies, best practice case studies are really, really important. For example, Project SOFT has 23 years of history. Like, I should be able to go and find a document that explains the rationale for Project SOFT. I'm sure it exists. The rationale, how it is implemented, the target population, successes, lessons learned, etc. So that, you know, if Trinidad and Tobago, St. Kitts, or whoever want to implement something similar, that they'll be able to get this information. So I'm just trying to move beyond just the simple inventory and make this inventory a tool that you could use to help in your work. And the idea, I think, of the case studies is something that the observatories can help with. Very few of the prevention programs, as far as I am aware, you can correct me if I'm wrong, have actually been properly evaluated. We talk about monitoring and evaluation all the time, but I know that very few across the hemisphere are actually put through a formal evaluation. What we should do is take those that were and highlight them. Make it a case study. We don't need a 100-page report, but make it a nice, short, sharp 9, 10-page document that people can easily digest to say, okay, so this is what they did, this is what they did wrong, and this is how I could apply it in my setting. So I'm just trying to move forward the idea of the inventory. The next issue that I would like to recommend is following on again from what Francisco said about alliances with universities and other academic institutions. I always like to use the example of Grenada, a country of no more than 100,000 people, limited resources, as Liz would always tell you. The way that they've been able to leverage the relationship that they have with local and international universities is a model that I think every country can follow. So they're able, as demonstrated yesterday during the presentation about vaping, they're able to do the research, get the information, get the data, get the evidence they need to inform what they need to do. So I think these are examples that we can highlight. It doesn't have to be anything fancy. It doesn't have to be a thesis or a fancy paper. But if this group can continue to meet regularly, all right, and have a 1-hour discussion. Liz, how was your intervention with vaping? What did you learn? What were the lessons learned? What were the outcomes? What was your monitoring and evaluation like? Your experiences can inform what other people do. But I find that we're going to have this meeting every year, and we're going to repeat some of the same things every year. We're going to say some of the same things. What we need to do is to continue the collaboration, all right? Continue the communication and try to share the experiences with each other. And if it is that the observatory can help in putting these documents together, we've become pretty good over the last year or two of publishing what we call information bulletins. Very short, very sharp, easy to read documents that everyone can benefit from. So I just wanted to make those contributions. Thank you very much.
Muy bien. ¿Aló? Sí.
Hello.
Muchas gracias, Pernell. Creo
Thank
que
you very much, Pernell. I think you have invited us to deal with things that are very concrete and challenging at the same time. But so for these ideas being proposed, for them to function, moment number one is that we keep meeting and having a certain consistency, seeing how we can make into reality these proposals. The hands are now beginning to rise. We have a move from St. Kitts and Nevis. Can you move? And then I go with the hands that are online. Okay.
Good morning to everyone. Hello? Okay, there's still a slight echo. I hope it's not too bad. Let me turn this off. All right, so thank you so much for the floor. St. Kitts and Nevis would have undergone national and small group consultation for the development of our national drug policy, which was approved by Cabinet last July. And when we assessed our demand reduction, one of the concerns we had is that there were a number of programs, but a lot of our people in St. Kitts and Nevis tend to act in silos. So where the Drug Council may have a program for primary school, and we do try to, publish it and share the information. Ministry of Health is doing the same thing, and next department is doing something else. So to address that concern, one of our implementation action is to develop or to have a consultation on a national drug demand reduction program to assess the gaps, to see where we are overlapping and where resources, we all know we have limited resources, but to see how we can cut down on the expenses. If instead of having about 3 or 4 other persons doing the same program, let's work together. Let's see how best we can utilize the resources for a more impactful program. What I wanted to share is a bit about our primary school substance misuse education and prevention program, since it has received the attention of the Ministry of Education and is now placed into the school curriculum, the public school curriculum, beginning September. Again, thank you. So what we did was a piloting in 2022, and we always need assistance with monitoring and evaluation, but we're not going to not start because we don't have everything. Our idea was, let's start with what we have, and as time goes on, as it gets more momentum, we can build on it, hopefully get more resources as we go along. And so we started off with simple pre-test, post-test, the guidance counselor feedback, the facilitators in-session review of our document to see how we can improve the document, and then we had post-mortem. Our prevention is a whole booklet. I shared one of our baby projects that we just started with Dr. Novi, and she was like, wait, you have a full booklet? I'm like, yes, it's booklet form, standardized. We use blueprints. I know Pernell mentioned of an inventory where you could go and see different programs, and I believe it was right in this section, sometime in Miami, I don't know if it was Chile or someone else, who introduced us to the Blueprint website where you could go and see various programs for substance abuse and other risk behaviors based on age and different population factors. So along with online research about what works, we also looked at blueprints for best practices that were already published on websites, clinical reviews and things along that line. From our first assessment, from our piloting, we realized that changes needed to be made in our manual. So we do have a second edition, and this is our second edition that has made it into the Ministry of Education curriculum. We had a post-mortem, we got feedback. We also had our intervention officers observing some of the sessions as they were being facilitated. Very silly and very minor, but very impactful. We were able to source little trinkets for persons to encourage participation and engagement. But what we realized that some of the facilitators were doing, if you said something, whether it made sense or not, or they were just giving. So it's like certain behaviors were encouraged along. So simple things like that, we realized, okay, we have to be a little bit more clearer about the delivery and things along that line. But I would take up Pernell, he stepped out. I would take up Pernell on his offer that the observatory is willing to assist us with the M&E and pulling it together, because we did have the monitoring and evaluation. We did have the post-mortem. What we are now working on, it received its first clinical review, is a longitudinal assessment. So we intend to follow these children over a period of time to monitor behavioral change and to see if what we're doing is really working and how we can change. So it's now being updated and upgraded, and then we carry it back again for the final clinical review before we then implement it into our programs. And that will be done throughout all of our programs moving forward as well. And St. Kitts and Nevis stands ready. If Dr. Novia was the first, she was like, can you please send me this? I'm more than willing to share what we have. It's, as I said, it's not our ideal as yet, but we have started somewhere, and we hope to build on it as we move forward, and we are ready to assist and share our information, because we are one people, we all have one goal, to extend compassion and help and care to see transformation and resilience built. So we are more than willing to help our neighboring islands, persons in Chile, Uruguay, wherever it is, so that we can see change and we can see progress in the communities that we serve. Thank you.
Excelente, muchas gracias. Angélica.
Excellent. Thank you very much. Angelica, I see you online. Good morning. A very warm greetings from Colombia. Right now, I'm at the Ministry of Justice and Law Legal. This gives policies on drugs. A greeting to everyone. Just to give you an idea of our strategies in this fight, we put our experiences to at your disposal for the implementation of strategic programs. Our programs were based on evidence, and several evaluators were on board to assure the quality of this experience. As we work with the whole territory, with communities, with people who permit us to know firsthand their realities, their needs.
Recording in progress.
And in our work experience, we have learned a lot. We have built a lot of tools, and we put for your disposal. And if we can help you, please do not hesitate. And that we can. At the same time, we have the intention of learning from you all also, from your valuable experiences that you're sharing and the countries that you represent. We are convinced that the exchanges of knowledge and this focus and the best practices will permit us to strengthen ourselves as a country, these capacities, and to identify communities that we can improve and work towards more effective and sustainable solutions. So I want to let you know also that I see that we want to let you know that in Colombia we have the Drug Observatory. It's a web page which brings together information, statistical information, studies, programs, and analysis on the drug phenomena in our countries. This platform is accessible to everyone, and it's a source that resource can be used as a guide. So from Colombia, we are prepared to collaborate and articulate ourselves, and in the same way, any way that you all consider convenient for you. Thank you very much. We have Loalis with your hands raised from the Dominican Republic. Go right ahead, you have the floor. Good morning. Good morning. Good morning. It's a pleasure to be here, seeing all of you gathered together in two faces. This time I'm participating virtually, which is not the same because we have still have responsibilities, but at one point in time I was absent, but I congratulate you. The part which I saw has been very interesting, and I regret not that yesterday when you were working on the prevention systems is a concept that's called to my attention since I participated in the meeting that was held in Argentina on the global coalition. I consider that as a concept which helps us to have this vision to be able to take into consideration all the ambits and the public population which we should be dedicating our prevention strategies for under that gap, which very often generates vulnerability. So before sharing what I want to share with you, greetings to all you. I see a lot of familiar faces, friends, close friends, and virtually I see those colleagues who that meet with that very meet in this space, Hamina Kawalowski. So I hope to see you soon in the Dominican Republic. A warm, a special greetings to you. I just want to tell you that I have liked the conclusions in which you that you're arriving at with respect to the creation of this repository and this catalog of documentation, which for us, for the DR, I consider for all the countries we share here that share here in this region, this will be valuable for us because we need to close those gaps. And sometimes we have we work we dedicate time. We need to dedicate time and work to other areas, but starting from zero is very difficult than if we had information already provided for and that have been effective in other countries. It's just a question of just adapting it. That is going to serve a lot because regardless of the fact that we are always trying to innovate and to create tools that are useful, tools that are effective, and there is always area that we drop our guard, and because of the same work that we have to dedicate ourselves, the same complexity that this phenomena has, and above all, the dedication that we need to prod on with the prevention. We need to have tools for several population, effective tools, and sometimes we focus more on some than others. And it's important to have experiences from other countries through this access. We can get assistance in reducing the time, the response time. From the DR, we also are very happy to be able to share company with some tools that we have created. That we consider important. They have been important for us, but I think that it could be important for other countries as well. And recently, about 1 or 2 months ago, we launched our protocol for suspected consumption cases in the school area. This has been very important. Interesting because it was created basically so that in all the educational centers of the country, we can apply this protocol and we can to be able to detect early the evidence of consumption and consumption of substances and what have an idea of what consumption is like at the school level. This campaign on the use of vaping, this has been an interesting campaign also. It's been an initial experience, but we carried out a pilot in several schools in the DR, and precisely we also had an exploratory study, which was what the experience which will be presented on the 26th of which was presented on the 26th of July. And with this evaluation was interesting, and this knowledge that because it has allowed us to have important information, which would help us to continue refocusing on in this campaign, not only because for the use of vaping, but other use of other substances. Uh, we also have a program for parents in the DR. We have several years implementing. We have been implementing it for several years. We did 2 evaluations, which we verified the effectiveness in among the person that have taken it, and we can share our experiences and the studies that were done in that program, as well as others interesting experiences. I know time is short, and I don't want to abuse of the time, but I just want to let you know this transformation has been taking shape, and we will be carried out together with the support of international organizations, and it is aimed at teen children and others who are locked away. And it's interesting to see how these children who are in this situation where the mother is reclusive and they see themselves in a vulnerable situation, because very often persons who are with them don't have the full knowledge of how to handle this situation. A strategy that's very interesting, which further on we can share with you. But at the same time, to be able to enjoy and obtain and to be able to take advantage of these tools that all the countries that are here present can share with us. Chile, for us also, I'm mentioning Chile because I always say that Chile is that country which one says, I want to be a country like Chile because they are always in the vanguard of the forefront of tools and diagnosis. I love the Chile model a lot. Other countries that also have interesting tools as well too. A warm hug for everyone, and I will continue to be here, and well, a warm greetings. Thank you very much. We miss you here, especially Johnny yesterday in the night time, last night. Interesting. I think yesterday I was saying that all of us have things to learn that we can learn. That is spoke of the Chile model, which we have a stability and time to develop, but we are also very far from as Colombia was saying recently, respect to the community work, the reduction of damages, the reflections that from which we want to learn how to do it better. We all have something to learn and all something to contribute as well too. We have Juan Carlos online, and then I come back with the detail. Good morning. How are you? But just to contribute something, one of the ideas that we can propose from Guatemala, but on the National Observatory of Drugs in Guatemala, we have this system of early warning, and we put it to the disposal to be able to request a support or information, and the doctor in charge of this observatory can be available, so you can have that tool as well too. You know that in several countries that are in the process of constructing the observatory, and we have this exercise already advanced, and you can take full advantage of this too. Also thinking of after the meeting, I was thinking a lot on the situation in which we find at the world level, for example, in Guatemala, many entities of the government entities, apart from CICAD, who have to do with contributing to the dealing with the problem of consumption and the reduction of the demand. Somehow they are limited based on the based due to the economic cost. So the idea is we can not only make a request, but we can also create awareness or make recommendations to the countries in Guatemala so that they can focus a bit more on the topic of prevention and treatment. All these efforts that are made in the reduction of the demand, because somehow that can also support that our institution have the resources to that would permit us to continue our work and also have not only the opening that the openness that which we've already speaking of, but we also have continuity. We can evaluate that. Thank you very much. Thank you very much, Juan Carlos. Here, I don't know who is first. If it's Novia or Novia, go ahead. Bahamas. Okay. Bahamas, you have the floor.
Blessings and peace. Once again, greetings on behalf of the Commonwealth of the Bahamas. I have one recommendation based on the work that we completed yesterday and some of the work that we've been doing over the last 2-3 years. And that one recommendation is it possible for us as a group? Is it possible for us as a group to develop an adolescent indicated manual and workbook? And that would facilitate a group think, and we'll also be able to come in with the different expertise that each of us bring to the table to quickly develop a new program. That's my one recommendation. Yay! I didn't hear yay, but anyway, yay! Yeah, I think the group think would be able to facilitate the development of a very good manual. Also, we'll be able to use the observatory to assist us in monitoring and evaluation of that program. And maybe next year in Chile, we'll be able to present a preliminary pilot results across the Caribbean to facilitate growth in all of our countries. Blessings and peace to you all.
That's an interesting idea. I think it could be very interesting. I can't see your name. Fiona?
Good morning, everyone. I was really hoping that we didn't have to go to work too, but we're here. My contribution to the discussion was in support of the research aspects and utilizing or universities and college. And so, Elizabeth, we will be piggybacking on you tremendously in terms of being able to get that research done so we can even expand it from a regional perspective in terms of us trying to see what it actually looks like for us in the Caribbean. A lot of times our data, is so American-based or just one country-based, but it would be really good to have a perspective of what it looks like in the region. So I think it would be a good idea for us to all collaborate on that. In addition to that, what I wanted to also say is that it's not a situation where we don't monitor and evaluate within the region, but it's a long gap in between as it is for a lot of things. So our last regional monitoring and evaluation exercise was in Suriname 2019. That's the last one I actually remember. So one of the things that we don't do very often as a collective as well is to see how we are progressing within the region on an annual or biannual basis. So perhaps in terms of the observatory through Purnell, that's something we can possibly do in a shorter period of time to be able to actually have a collaborative effort along with having an idea of what actually makes an impact. You are so right, Karimu. Everybody's always doing the same thing. So we have several organizations within one country doing the same thing as opposed to us actually operating on a national basis. And so one of the things that I think that we also need to push towards is getting our programs accredited so that it becomes a national standard. So that is something that we have been working on trying to get done for some of the programs that we have already implemented in terms of getting nationally accredited so that it can be the standardized program that is utilized. Thank you.
Gracias.
Good morning, Lyra Thompson Hollingsworth from Trinidad and Tobago, and I would also like to recognize members of my team who are logged in online. Together, we would like to support the development of a repository. I truly believe that there is value to add, that each country has value to add, even in the context of where there are limited resources. One of the things I'm very proud of in terms of Trinidad and Tobago's performance is that we have the ability to be creative even in the absence of resources. And one of the ways we've been able to do that is to build relationships and have strong interagency collaboration. There's so many programs and initiatives we've been able to implement simply by building bridges, building relationships with police youth clubs and community-based organizations and other ministries who are doing similar things. For example, the Ministry of Community Development have parent support networks. We've been able to implement programs just by plugging into those networks to do work. And so it means many times we can carry out a successful program, monitor it, evaluate it, without having to spend a single cent, just by looking at what is currently available, what networks are out there, who is doing what programs, and simply build the capacity to do that. So I think we will certainly have that kind of value to add, so we can help those other countries with limited resources, as well as looking at what other countries are doing. And I think one of the ways we've been able over the years to identify what our gaps are and to identify those linkages is looking at the MEM. And I know this is not a MEM meeting, but out of CICAD, the MEM has been very instrumental in helping Trinidad and Tobago identify where our gaps are and how we could truly try to bridge those gaps. So I support the implementation of the catalog, and I truly believe we have a lot of value to add as a region, as the hemisphere. Thank you.
Muchas gracias. Sí, yo creo que además de la colaboración entre países, estamos devolviendo a Jimena y a Adrián con mucha colaboración entre con Adrián Meme, el MEM, el observatorio, la unidad de reducción de la demanda. Y creo que de eso se trata, ¿no? De la sinergia que podemos hacer de los recursos.
Have with the resources. I'm going to do a short summary of all the ideas, and I'm going to ask my colleagues to make their final comments. Many interesting things have come up. I think we're going to have to link us, to join up with Chair and this group of experts and Yvette and see how we can continue. Jimena, Alfonso, who is online, because I think they are very interesting things, and the greatest risk is that what Pernell mentioned. If we be here and next year we'll be in Chile, and not having such a good time here in Barbados, but the same thing over and over again. So we need to continue seeing how we can proceed. We accept the idea of a catalog of programs with different recommendations and recommendations that Bernard mentioned. The repository of concrete tools. We can see among them flyers, campaigns, instruments of evaluation instruments. We have evaluation instruments to be able to carry out the measurement before and after the intervention. That's another word, tools. The alliances with civil society, the exchange between countries, which we also mentioned, that we can have annual planning. What can we do with strengthening our knowledge in the exchange programs, the partnerships with universities and observatories, the evaluation of the programs as an important element, and a concrete idea of having this manual for adolescents, for the instruction of adolescents that Bahamas proposed. We have 8 ideas. It's not too little. we can see how we can give continuity to these. I thank you for the space. I thank you for the conversation that we've had. It was our intention to be able to SWOT our prevention system, and from there construct collaborative efforts. So thank you very much on my part, and I pass on to Jimena Allison for them to make their final observation.
A robust conversation, I think, was had today. And when we even look at the meaning of collaboration, we can think about partnership, union, and producing or making something, and I would add making something better. It was really good to hear from Colombia. We were looking at alliances of universities. We were looking in terms of, web pages and the catalogue, and that's what is so important to have when we leave here, to have things that are tangible when we leave here, that we can look at and we can pour into. So I think that's key. I just almost jumped out of my chair when I heard St. Kitts and Nevis, because the fact that you might not have every single tool or instrument or resource, but you're still able to produce something that is now being taken on by the Ministry of Education. One awesome thing that is happening there in St. Kitts and Nevis, and it's not a big place, as we know. So kudos to my colleague, and that's just a testament to what you can do. I think, if nothing else, when we went through COVID, and my colleague from Trinidad and Tobago spoke about being creative, right? And the importance of building relationships, and some things don't actually cost money. I think sometimes we can default to saying limited resources, but knowing that this is a group of experts that is already have that understanding, that insight, and that experience to be able to share with each other. So we are really thankful for this workshop and understanding the importance of this partnership and union together.
Muchas gracias. La verdad es que desde Barbados el mundo se ve distinto. Creo que
I think that
hemos abierto acá una
we have opened, each
ventana
one
de
of us,
oportunidad que
open
nos
a
puede hacer una
window of
puerta.
opportunities, which will be a door. I think that many initiatives, much willingness to proceed, and with the observatory, we have a relationship, a mutual collaboration tool. We're going to have a lot more work to do together. I was thinking, for example, since there's no financing for the international consortium of the universities, but nevertheless, we have the network of universities, our universities. Therefore, it doesn't cost us anything to call the meetings and of the group of experts or of you all, with the network of universities that we have in the region. And of course, many are going to be interested in supporting the systematization and the research, as well and in evaluation. The universities are desirous of having funding areas from which they can collaborate and develop their activities that can have impact, that can show how they can be linked with the societies and face the challenges, that day-to-day challenges that we have. So many opportunities are being opened up for us, and I want to thank the participation and the generosity of all of you. And I think that we're going to have now that we have to work with the presidency and the vice presidency to see how we can give continuity. It's possible, and we have done it in the years before. The presidents of group expert groups haven't worked among the large sessions, having working groups, perhaps thematic, but we have to maintain a regularity of the meetings. I invite you also to see what the resources that each country has to be able, that we can rely on, if you have rooms available or whatever. how easy it is to rely on interpretation. Some also can have the support of the private enterprise. Who knows, an airline that can provide or a hotel group that would prevent us to come together. But also, we also have nowadays the possibility of, we've also, we're now accustomed to virtual work. It's not the same, but we have, unlike years gone by, we had to restrain instrument and distance that we have grown accustomed to this habit, and we can maintain sessions online. So, for example, we have challenges, we have very good ideas. Let's see how we can give shape to these. And I thank you for your love, your enthusiasm, and I love this because I think that you were really persons who work in the reduction of the demand. We do it out of vocation and interest that we have in the topic. As a personal challenge that we undertake, and nothing will stop us. I think here we have the strength. We on the screen we have on the screen we have the strength of our work, and we will continue to develop despite of all the adversities. We continue to work in this, and we're gonna come out as winners. I just wanted to thank, and we're gonna recap all of this information. We put together all this information, and by close of day, we might have some work proposals to work on in the future. I want to thank the presidency, Barbados, Chile, for having arranged all of this, and I think they have extracted the best of each one of you. Thank you very much once more.
One, two. Thank you, ladies, for leading that workshop. And delegates, I thank you also for your engagement, both online and in person. We move off to our coffee break at this time, and we'll start at 11 o'clock sharp with, yeah, you have a little extra time because our next presenter is virtual. Or if the presenter was in person, we start 10 minutes earlier. But because our presenter is going to be online, we'll keep to this time of 11 o'clock. So a coffee break at this moment, ladies and gentlemen. So even without the 5 minutes, most of us have returned, so this is good. There's been some conditioning with the bell, so so we're going to start in about 1 minute, just making sure that our online presenter is ready, his presentation is up, so that we can have his facilitation. And we have 3 presentations that will flow one after the other. So I'm asking those presenters to also be prepared. Maria has told me that she's ready, and I'm just encouraging our representative from CICAD and from Street Gospel Ministries to be ready. Okay. That was more for the team. That was more for the delegates. All right, delegates, we continue with the second half of our morning with updates from the Pan American Health Organization on drug demand reduction. and this will be facilitated by Raul Sanchez, the advisor alcohol and psychoactive substances, non-communicable diseases, and mental health for the Pan American Health Organization. Mr. Sanchez, thank you for joining us virtually, and over to you for your 30-minute presentation.
I'm trying to share my presentation with you. Can you see it? Are you hearing me? Good. Thank you very much. Well, good morning to you all. To Angela Crowdy, Jimena Kalowski, my friend, to all of the colleagues from CICAD and from the secretariats and the drug commissions which are present in the meeting, all of the experts. And I want to greet you on behalf of the PAHO. I've been following the sessions with great interest, and we are learning many phenomena, and we can work on these with CICAD in order to be able to have cooperation strategies. I'm new in this post. I've been here for 8 months, and this has brought me to know work with Juan, and in this job of truth, I have lots that I want to tell you, but I'm going to begin.
Te voy a pedir que hables más lento para nuestros intérpretes, que todos los que hablamos español nos aceleramos.
Those of us who speak Spanish tend to speak a little bit quickly. Of course, thank you. Of course. Well, first of all, I believe it's very important to point out that in June, we signed this high-level agreement with the OAS and PAHO to give great priority to mental health. And I think this provides a framework, a very important umbrella to facilitate our collaboration. So I want to congratulate you. And it's a work that we've been doing that CICAD and PAHO have been working on for a long time. But I believe this agreement will help us to improve our actions. You know that WHO is doing studies that have given us a very good idea of the phenomena that are occurring in the world. The famous study on the global burden of illness, and it shows us that in the last 20 years, the deaths that were associated with mental illness and alcohol abuse have increased by 180%. In the Americas, we are about to do a specific publication about the global burden of illness associated with drugs and alcohol in the Americas. But I can tell you in advance that we estimate that in 2019, the mental illnesses and linked to substances were linked to 16% of the deaths in in terms of disability in the Americas, there's been an increase in death linked to substances. It's very important to point out that 71% of deaths linked to mental health have to do with drugs and alcohol use, and not necessarily with the deaths of dependent people. We need to be very aware that many of the deaths that we've been seeing had not only to do with ingestion of alcohol, but dependence on alcohol. We have been working, therefore, in the unit on non-communicable diseases and mental health. We which is under the control of Dr. Haynes. Of course, we are flying the flag. So I want to tell you that we've discussed what we discussed here, which is the importance of what are the gaps that exist in the region in terms of improving preventative programs, services for treatment in terms of alcohol and drugs. And of course, we need to know what are the factors that are linked to this, the problems linked to drug and alcohol consumption, which are stress, financial problems, which are very present in our region. Political and social instability, easy access to psychoactive substances, and favorable legislation. We have, therefore, to say that the consumption of alcohol costs 2.6 million deaths in the world. It therefore represents 5% of all deaths worldwide. And in spite of this, which we're talking about there, the lack of funding so that we would be able to improve prevention programs and treatment problems. It is estimated that 400 million people have alcohol consumption disorders, 209 million persons who meet the criteria for alcohol dependence. The effect of alcohol in the Americas, we have an estimation of alcohol per capita consumption, which is near to 7.5 liters of alcohol, which places us as the second largest region in terms of alcohol consumption. This what really draws our attention, since we are a region in which most countries drink alcohol every day. We have 2 or 3 exceptions in the region, but even still, our levels of alcohol consumption per capita are very high, which has to do with episodic and explosive consumption. But in addition to this, this is also linked to deaths, specifically in the case of alcohol linked to cardiovascular disease, digestive issues, and cancers, something that we really don't promote enough, the link between alcohol consumption and cancer. There are also injuries. There are also which we really need to work on prevention in the context of alcohol use, injuries which have to do with driving under the effects of alcohol. So with regard to drug use, psychoactive drugs, I believe that we've had a very interesting discussion of what's happening in the region, and we can begin to see what is the actual situation in the current situation in the region. We have cocaine and cannabis, which continue to be the major drugs consumed. When we look at the surveys of households and students, we expect that there will be an increase in cocaine use and other drugs, especially in the countries in the South, which will be record, especially in terms of cocaine. And in Europe and the US, there are also local markets for these drugs. The significant increase in methamphetamine and or crystal consumption is possibly extended towards other countries in the region, and the increase among women is very significant. Yesterday, we spoke a lot about the issue of dealing with stigma and discrimination among socially vulnerable groups. And I think this is very important. We have very high levels of experimentation among adolescents, but also we must forget that the group that has the highest level of alcohol and drug consumption are young people, young adults. And yesterday in the workshop, you mentioned something which is very important, which is that we need to work with older adults. I must confess that one of my research topics when I was working with the International Board for Regulation of Narcotics of the UN was precisely the fact we realized that this increase in consumption, very significant increase among older adults, has not been addressed adequately. And there are 2 problems. One is that we don't measure, we don't detect, because households surveys are done among persons, not done among 65 years old persons. But when countries have the possibility, the opportunity to measurement, then we realize that in those countries where they have measured drug use among elderly persons, we see that it's more accelerated. The increase in their consumption is even faster than among teenagers. The countries that have found that in the last 20 years, they've increased by 200 to 300% the frequency of alcohol consumption among older adults. Alcohol and drugs, excuse me. So there are many phenomena associated with this issue, and we don't have programs for prevention focused on this population. Obviously, as you know, the global trend, due to the fact that the drug cartels, it is more profitable to replace drug consumption of plant origin by synthetic drugs, and which are these synthetic drugs are easier to adulterate. And young people, when I speak about this with them, I tell them, you're living in the worst period to use drugs, because now you don't know what you are using. And with all the efforts that have been made in CICAD, with the early warning systems and national observatories, this has allowed us to make significant advances in our countries. I had the opportunity to visit the Alcohol Observatory in Mexico, and the truth is that their work is well evaluated and well led by Marja Haynes, by Bernal Clark and Jose Luis Vasquez. We always have the opportunity to make great advances to strengthen this observatory. Although, whether you believe it or not, perhaps a problem in Africa or it's not, and Europe, a problem in the US, in various problems in the region, and you have also detected this thanks to your early warning systems. In terms of synthetic drugs, you've mentioned what's happening in the music festivals and the parties. The young people are buying what they think is ecstasy, what they think is LCD, but in many cases, there are other substances that they're using which are much more toxic and much more dangerous. I don't know if you know, but half of the seizures that have taken place in the world for LSD, it's not LSD, but it's a substance in the NV or ME family, and it's much more toxic. So it's a context which is very important for us to take into consideration with regard to the risk facing young people. In regard to drug use and the phenomenon of using I work with forensic doctors from the prosecutor's office in Mexico before I came here. And in research that we did, we had the opportunity to participate with the National Institute for Psychiatry. And we were wondering, pink cocaine that you have seized, what is it and what's happening? And we're seeing that it is ecstasy, which is adulterated with pink cocaine. And then we have new trends in terms of use. We mentioned yesterday the issue of vaping, and the problem with vapors is precisely that. I also believe that they are passing below the radar of the adults. We're not detecting adult use. The adults are not aware that their children or their students are what they're consuming with while they're vaping. And these vaping devices are easy to acquire. So it is not easy to regulate this because it's not the substances, they are devices, and therefore they need to be regulated. They needed to be regulated or even prohibited. And when I worked with one of my patients who was a teenager, and when they caught him with a vapor, he said it was marijuana, which is, he says, fine. They're cooperating so that they have money. These young people have money to buy these vaping devices. And we need to be aware of the new phenomena, which is wax type cannabis, which is a super powerful cannabis. It's a synthetic form of THC. And they can also add other substances to this cannabis. And therefore, they are 60 to 95% more potent than the THC is very, very easily accessed online. So the resurgence of the use of hallucinogens for ritual or therapeutic purposes, and which is very concerning. I see two worlds: a world in which we're studying which we're seriously examining with randomized controlled clinical tests, focusing on ketamine and other drugs. And ketamine is very advanced. Ecstasy is very advanced. And there's a procedure to use it under medical supervision. This is a world, and then there's the other world where we have shamans who are selling these drugs, and they're saying that they have a whole industry, and they're claiming that they can cure people. They can cure your alcohol, your anxiety, and you come to so many sessions and which cost so much. So therefore, we have two worlds. We have chemisex, and I believe this is something that is very important that we put on the table: the practices of drug use. During sexual relations, sexual intercourse, we have a more vulnerable population, which is men who have sex with men. In some cases, in the Islam, where this use also involves injection of substances, and these drugs are also adulterated. And so we're finding that finding samples of heroin which are in the street, which are unfortunately a veterinary drug, and therefore the wounds, they heal, and it causes serious problems with gangrene. We have an opioid crisis, which is not only, it's just concentrated in certain countries, and the opioid crisis also includes the use of opioids without prescription. And in our region, we have the problem of tramadol, which generally is sold without a prescription because it is not an opioid, a very powerful one, but once you become dependent on opioids, it is like any other dependency, any other addiction. So now we have all the new opioids which are synthetic, and there's a whole issue that I need to tell you about, which is I learned in GIFE, the nitrocenes and morphine products derived from opioids. So the pharmaceutical industry during the 1970s and 80s thought that they were good medicines, but they realized that they were too powerful, they were lethal, and they decided we're not going to sell these products. So now organized crime is using these products, and they are using new formula. And this is a very important for us to take into consideration some of the commercial factors linked to alcohol and tobacco consumption, sometimes other drugs as well. But then it's also important for us for prevention programs. When we think about these programs, that it's not just about talk and workshops, but we also need to focus on regulations. And now we come to see the cases of alcohol, which help to reduce the availability and the regulation of other drugs. So we need to change laws, change regulations, change the social environment, and we must not normalize consumption of these drugs. And not all of the countries of this region have been able to develop national plans and policies. And I'm thinking, for example, in the case of alcohol, we have 56% of countries in the Americas which have achieved this. We also have the possibility to improve educational programs, brief intervention and treatment programs. We need to consider the quality of the treatment. Remember, the availability of treatment for addiction is low. Only 10% of people who need treatment actually get it. And in Latin America, it comes to one of every 17 people who are looking for help actually get it. So we also need to focus on the access to medication and the quality, the treatment programs, and the respect of human rights. Another issue that we need to remember is that our countries signed the 2030 agenda, in which objective 3.1 has to do with improving health. And obviously, this is linked to improving preventative and treatment programs in terms of addiction. And we at PAHO and your ministries of health came here to sign a strategic plan in 2022, and the treatment of alcohol issues and psychoactive issues. And it has 4 strategic areas. It has policies, plans, and law with regard to public health, prevention of the use of alcohol and other substances among young people and children, promotion of early interventions in the area of primary health, and research and evaluation. So we took those strategic areas so that we could rationalize the efforts that are being done in the region. So I'm going to begin now to share some things. I'm going to share my QR code so that you can access the tools that PAHO currently has in its portal. And I think that these are very important tools with regard to developing policies, plans, and law. There's a manual, which is very well written step by step so that you can go to diagnosis and then focus on a local or national plan with regard to drug and alcohol consumption. I recommend that you check out this manual. It is extremely instructive, very, very useful. We also have a virtual course on drug and public health policies in our virtual PAHO campus. There's a very important training space. Remember that PAHO does it. It is technical assistance, and we provide skills. And then we have this virtual course on policies and public health. There's an integrated vision, a view of the issue. We have different strategies which go from universal selective treatment, detection of treatment, rehabilitation, harm reduction. The issues that we have to take into consideration are discrimination or non-discrimination, and we also need to offer health services. This course also has other tools. And then we have a course that has to do with strategies for alcohol issues. And as you know, the acronym is BEST BUYs, the best practices that have been proven across the world in terms of alcohol policies. And many of these policies, which focus on prevention, and they deal with the environment, regulating availability of alcohol, points of sale, the number of points of sales, opening hours and days on which these products can be sold, the ages, the persons to which they can be sold, the issues of driving under the effects of alcohol, improving early detection systems and treatment in public health systems, regulation of marketing. Now we live in the era of social media, and the internet is more important than ever. And obviously the impact of taxes, applying taxes and a fiscal policy in order to reduce accessibility of alcohol. This is environmental prevention. And we also make the rules and the laws work in order to have an impact on the availability of substances. We have a course on our virtual campus. Here's the QR code so that you can access this course. And we also announcing a series of webinars where obviously we're going to coordinate with CICAD, especially for those who work with illicit drugs. But we'll also have a series of webinars during the next 2 years on safer structure, and we're going to invite everyone here. Obviously, we offer the strategy of technical assistance to countries. So we also work with countries providing technical assistance, training, and obviously helping them with their public awareness programs within the communities. And of course, I wanted to point out, listening to you yesterday about the need of creating prevention programs for pregnant women, we also have a course on the virtual campus, which focuses on alcohol and pregnancy, where we talk about alcohol and its effects on pregnant woman, on the fetus, the newborn baby, because there are effects when the woman is breastfeeding and this baby, or whether the alcohol passes through the mother's milk. Obviously, much of this has been spoken about in the family issues, which we'll discuss in this course. So the strategies for detection, also explains how we can set up a training program and how we can implement it within the public health system. And of course, you can send messages through the public health system of alcohol and pregnancy so that we can avoid stigma. I want to recommend that PAHO and WHO, with regard to the interventions that we're doing with regard to alcohol and psychoactive substances, there are brief interventions focused on treating cases, and the more serious cases, treatments, drug treatments or pharmacological treatments to manage abstinence and preventing relapses, which is very important. We must have drugs and treatments available, psychosocial treatments based on evidence. Many of these are cognitive, behavioral, or motivational. So we have programs for harm reduction and reinsertion and social rehabilitation. I'm saying all of this because we have a model which you already know, WHO, which you can see this pyramid, which shows how the majority of our efforts are being focused on improving community treatments and primary health care. But early in all cases, when we think about providing treatment infrastructure, we think about the point of the pyramid, the top of the pyramid, which is specialized treatment programs. We need to open hospitals so that we can have residential treatments. They're necessary for the most serious cases. Most of the cases that we're going to deal with here in the bottom part of the pyramid, and therefore it's important to plan organization of services based on these models. As you know, how should a treatment system be? Well, it should be accessible. The services should be accessible. We need mobile services, and so that we can we also need to meet the needs of those who need to be admitted for treatment, people who need treatment, and the program should be based on evidence. And of course, we need to focus on the respect of human rights. We can go even further about treatments programs recommended by WHO, and all of this you can find in our courses and our webinars, which I've mentioned. And I'm going to also speak about the research and the evaluation of services. And I believe all of those data that you've provided in terms of the primary treatment of alcohol or tobacco or drugs, these are important data that we need to have access to see how the services are covering and what our capacities are. And I also want to point out that the courses that we have on the portal has to do with measuring the per capita alcohol consumption. And here's the link so that you can access that. And we recently have been working on a monitoring system in which you can see we have a tool to see how policies for control of alcohol and drugs and treatment of addictions are advancing. And you can continue to advance and to continue to these data, and you can see how things are advancing. I also had the opportunity to be part of the mechanism for multilateral evaluation in my country. And I think that Dr. Adrian Noble did it with the unit, and I think that's very important. So these tools are for PAHO, but it also is for the whole region and for the different institutions. I'm going to leave my email address here, and you can contact me if you need any kind of technical assistance. Remember that PAHO has a structure. We have in the region, we have an office, and we have an office in every country, or in some regions, and we're beginning to work. So I want to thank you so much for your attention, and I hope that I've spoken slowly enough so that it didn't cause too much problems for the translator. Thank you very much.
kind of adequate pace. We were able to understand. The translators were effective. So thank you so much, Raul. We go on to our next presentation, results of the evaluation of the program Building Families, and that will be facilitated by Maria Dueñas. Maria? She is the regional coordinator for the prevention and treatment of drug use under the United Nations Office of Drugs and Crime for the Andean region and the Southern Cone. Maria, over to you. Presentation. Could we pull up the presentation for Maria, please?
Buenos días a todos y a todas. Gracias por este espacio, gracias a la CICAD, especialmente a Jimena y a su equipo, al señor Alfonso por la invitación a Naciones Unidas. Para nosotros, desde nuestra oficina en Colombia, que atiende la región andina y el Cono Sur, es muy importante estar aquí, compartir con todos los colegas de los países.
Excuse me, we're not hearing on channel 1.
No translation. No están todos.
All right, can we proceed?
Can you hear me now? Testing, 1, 2, 3.
I can hear you now. Yes, sir.
Yes, perfect. Okay.
Thank you, Maria. You can continue.
Yeah. Gracias, María. Puedes continuar.
Bueno, decía,
I was saying that it's a pleasure to be here, sharing with you. I thank Jimena and Alfonso for the invitation. For us, it's important to share with everyone from the countries to listen to you and to give our support as well based on our experiences and the work that we have been doing. It is for the service of the countries and for the public policies. We have a mission to promote the programs based on evidence. This is easy to say so, but it's difficult to achieve it because there's a lot of political will, but we've listened that there are several economic challenges to be able to generate that evidence. The idea of this presentation is that we're going to have two moments. One to give you an idea of how we're going to generate evidence evidence for the prevention program, which we apply, especially in Colombia, in the framework of the project and the project, demonstrative projects. We coordinate with CICAD and coordinate with other agencies and participants, and we participate in the framework of the project. We decided to, in the framework of government framework, not only to apply the intervention, but also to generate the evaluation and the intervention. I just wanted to talk a bit about what does it mean to generate evidence. But it is very important to understand that we required to generate evidence to tell us if it is valid and if it supports a hypothesis that we have, a theory or an intervention. It is not only about something that it is obvious that something works, but also that there's evidence that something has worked and it's tried and proven, so that we can make informed decisions and advance in the understanding of the phenomena. in the context of the prevention of the drug, we know that they have science behind that, and that science is telling us that we should investigate to know what effective plans we just carry out. And on the other hand, let us work with data and results that are proven a bit in contraposition of the programs that are created only from the institution and anecdotal experience. In the pyramid of evidence, there are many forms to evaluate. So let's see this pyramid as studies most used and which are more costly and which possibly don't have the same effectiveness. So the studies that are used on which we create the standards refer to studies cross-section over 15 or 20 years. Now we have these case studies, and then we have studies of short studies. Then we also have 10-year studies. We also have clinical studies, and the one that shows more evidence is the analysis. As a type of a study which permits us to evaluate the effectiveness of an intervention during the process of the intervention. This design looks more like a scientific experiment with cause and effects, with a high grade of trustworthiness, and it's less costly than the studies of long-term studies. We decided to apply this study programs to parental aptitudes. I wanted to mention that we strengthen the link and all that has to do with the parent caretaker and the family link and the communication with their children to increase their supervision and to transmit those expected values. And that is a little bit what the international standards is with respect to how we deliver these tools to the parents, our fathers and mothers, so that they can complete that child process. And so what do you know about the inclusion of the parental inclusion? We know that this inclusion has this tells us if it's an important indicator. If to know what if you can reinforce that strengthening. The family, building families is one that comes from what is a strong families, and it was created in the United States and boosted by the Pan American Health Organization and the United Nations in Central America and South America, and so strong families seek to improve their involvement. So let's say it's in a simple manner, and we apply it to families that can be migrated families, where it is much more difficult to reach, because the strong families, it's a long family, it requires a lot of permanence, and it is a little bit difficult for persons to participate in all the sessions. So we were able to construct 4 sessions with groups where we seek to strengthen the parental competencies. This is a program based on evidence, and it is aimed at children, parents of children between 8 and 12 years old, and it has basically 2 key objectives: to lessen the factors and the high levels of stress in the home and the consumption of substance. And on the other hand, it seeks to increase those protection factors, teaching the parents how to discipline in a positive manner. What is the social support that they can count on? The management of emotions, the taking of decisions, the self-awareness and resilience. So we go back into the decision taking, which we had applied. Let's evaluate what happened with the program. So we find that in the method, which helped us to fulfill those two objectives. One, to evaluate the receptibility of the program in the Colombian context, the effectiveness in several aspects, the support of the couple in at childbirth, rearing a child, the fact is the relation between mother, father, and child, or the caretaker. In our families, there's not always the family, the mother and father, and there are also other people who bring up the children, the step parents as well too. We have the modifications and emotional problems such as conduct. We also work with the topic of hyperactivity or attention. We carried out. We selected the design and we practiced it. We focus on the implementation of the program. We articulated it in this intersectoral manner so that the Ministry of Education and the Ministry of Education come together, because these programs were chosen they are chosen at the schools, and we need those partnerships with the schools, the public schools and the private schools. We had random groups of families, 44 in two neighboring municipalities who have similar problems, for a total of 267 parents. We prepared those two instruments, which we call papas, and the other parents. We divided the two families into groups. So this is a evaluation which is done during the implementation of a program, with 3 cuts before the program, during the program, and after the program. And then we do the implementation with the control group, understanding that we can't create any harm. We have to offer the same program to the control group. We do the process of critique and analysis, and we can get the evidence, solid evidence. We are not talking about the impact, but change, long-term changes. But we are talking about the acceptability of the program, the efficiency of the program, and then this would help us to be able to take it to other countries with similar conditions. The instruments, as I was saying, there are 2 instruments. The alpha at the scale of we evaluated the scales of the family adjustments. We evaluated the rearing practices of the families, the relationship of the parents and the child, and this survey has 25 items. We evaluated 5 areas: emotional problems, the problems of conduct, the hyperactivity, the lack of attention, and the problems with inmates. And here we're going to see some of the results which we're going to have, and it is worth pointing out that the event of this. So I am saying, I'm giving this a summary, and I'm anticipating a little bit and we'll have the consultants, Jimena, and they're going to be at the event because the idea is to give a return to the municipality of what were the successes, and that you can identify, analyze these findings, and develop sustainable programs. And this program has the capacity of being installed, and you can replicate this program. And this is very important because the cooperation exercises must reach, but we must also know how to lead the program, not only to stay, but how to lead when the countries can handle themselves and develop the implementation processes. With respect to the results, we have in the questionnaire the strengths and difficulties. That's the 4 sub scales related to conduct with the parents and the social. There are important differences between the experimental group and the control group. And the first changes that we were able to see in the first sessions where there are, let's say, more ownership in the other group than the control group. It doesn't modify the program. It's the hyperactivity, lack of attention is a program that is short, and it can be modified, and there are lots of significant difference between one group and the other. In the toughest scale, what is related with the consistency, parental consistency, positive influence, the relation, parents and children, parental adaptation. We have significant difference between both groups, but the changes are evident in the family of the third one. These families that participate are classified according to so those that have difficulty in regard to their difficulties, relationships with the families, and those that have greater difficulty, those are the families that were able to improve in this subscales. The main changes are in the first sessions of the program, and then in the subscale related with the rearing, there are not significant differences. We are also seeing that we hope changes in what has to do with the hyperactivity, lack of attention, and the coercive upbringing, and it doesn't show any big differences in those 2 subscales. In conclusion, we can continue to rely on the interventions based on the parental abilities, constructing family. We can generate transformations and generate in childhood in the contexts of vulnerability, and constructing family and the specific solutions to conflicts, peaceful solutions to conflicts. This shows us some level of impact, and this social support is very important and the confidence in the caretakers. The interventions are based on the families, and they also the best strategy to prevent violence and abuse in infancy. Building families has a high acceptability in families in 2 municipalities, with 2 adjustments in the curricular format. The first is the 90% out of 90% out of 100 people have received it. I'm going to read 2 testimonials, one from a mother and the other one from a father. The mother says, the most important thing is getting to know my son better getting to know myself and learning how to handle many situations. Sometimes you can make a mass out of a kicker. It helped me to learn that there are things you can learn to handle without much stress. One thing is that if we mistreat them, you're saying the wrong words, the way in which we say them, this helps us to see other ways of correcting the child. I have some photographs here of the colleagues, my colleagues working with the groups. As I told you, we left a box of tools, and the idea is to, based on those exercises, we can prove that the program works, and we can continue to conduct the program. In the second part, I'm going to, I have 10 minutes. My colleagues have asked us to highlight some of the activities that they are promoting and which some of you are familiar with. We have the CHAMPS program, which basically is an initiative that seeks to strengthen the relationship between children and adolescents to prevent consumption, and is based on the healthy development of the children. The services integrated with the science and models to see effective preventive program. I was saying to him, telling Jimena, that I see with a bit of the exercise that we were promoting with Francisca, the Chile team in this discussion of mapping these programs and to see how we can continue preventing this preventive program is a bit. It's the mission. The difference is a little in the reaching this. But the idea is to invite the countries to invite the countries to have preventive models and services for childhood in an early prevention. Let's say of these 10 countries which are implementing CHAMPS, currently there are 3 countries that are linking themselves with Ecuador, Argentina, and Brazil. The other program which my colleagues have asked us to mention is the one is aimed to the prevention and consumption of this is a new orientation concept to train officers to apply the law in a way who work in prevention and educational areas. It's a new guide, it's a document. It has been applied in Panama, and we have plans for training in Ecuador, which are ongoing. The other program, which is also new, is Friends in Action, which is called Focus, Friends in Focus. It's a new program among peers to strengthen the work among peers, and is being used with youth. And the program has is led by experts, and we hope to have a multiplying effect, a cascading effect, so we can broaden the youth networks. Is a prototype which in 2025 has and there is a pre-pilot for Central America and in the fourth term of 2025, and it will be done in Spanish. The other top is the treatment, the quality assurance of the use of drug disorders in Latin America and the Caribbean, services and system. And this, the COLAC has been working in Latin America and the Caribbean in Bolivia, Ecuador, Colombia, El Salvador, Guatemala, Honduras, Mexico, Panama, Peru, the Dominican Republic. This program, what it seeks to achieve is to promote the treatment systems can be adapted to the international standards of treatment. We know that these standards, international standards, should sometimes have standards, but we have to start applying them. We must have advocate to put this in the public agenda to be able to make decisions and we understand that to invest in the treatment and treatment with respect to human rights and health public, and it should be very effective. And in Kualat, in 2020, the first phase, we have the publication of 2 regional reports. We developed a diagnostic tool for 10 countries. We developed a roadmap for all the countries. We prioritized, we did the piloting of the key qualities in Bolivia and Dominican Republic. We have trained more than 150 professionals, and we have done consultations with delegates. And the second phase, we translated some technical documents from English to Spanish. We have webinars with experts. We had a regional meeting in Cartagena. We had the creation of a working group, Group A, for evaluation and treatment of outcomes, and B, development of minimum standards for the accreditation of treatment services. And Kuala 3, we had webinars with experts. The last meeting was held in Mexico, the regional meeting, and we continue working with the working groups. Group A is working with the provision of technical assistance, and Group B, a piloting minimum standards for accreditation of treatment services. And then we have workshop in Guayaquil and in Bogota. In Bogota, we are working with a framework of the gender framework, where we are producing guidelines based on experience so that we can deal with the ones dealing with women. And we are going to have the opportunity to practice, to participate in some with experience, people who have experience in drugs in Spain. And there are several interventions that have been developed. And as I was saying, for us, it's very important to serve as a bridge with the country, for the countries, so that the countries can have access to many of these programs. They can get trained, they can transfer their professionals, and they can continue to broaden these exercise of prevention and treatment in Latin America and Central America. I thank you very much for your attention.
We move on with the interventions by civil society organizations in the work of drug demand reduction. And we have 3 presenters who will share within that 30-minute slot. We have an online presenter. I'm made to understand that we have an online presenter. Is he present? Jorge Oliveres. So while we wait for him to join, I'm going to ask Cheryl Griffith, Coordinator of Services and Senior Counselor at the Center for Counseling Addiction Support Alternatives, better known as CASA, to join us at the head table. In addition to Steve Skeet, Founder and Director of Street Gospel Ministries, and Stephanie Skeet, Administrative Assistant of Street Gospel Ministries. You can just join us here. Good. So we have our 3 presenters, and each presenter we have 10 wonderful power minutes to share. I know it's not a lot of time for to really expound on all of the work that you do, but we're bound by time. So each of you has 10 minutes to share, and I'm going to start with you, Cheryl. You have your 10 minutes, and then we'll follow with Street Gospel Ministries, and then our online presenter, Jorge Oliveras.
All right. Good afternoon, everyone. Thank you. Now, this is my first time being in one of these forums, so I am very appreciative of it, and I really appreciate all the presentations. I recognize that we do similar things, and I agree that we need to really come together and have the observatory so we know what we do and how we can share our work and make it lighter and easier. Oh, yes, thank you. So this is who Cheryl Griffith. At the Center for Counseling Addiction Support Alternative, which is known as 23rd year of existence, we do a lot of work, although there are few of us. We are primarily an NGO, that is a non-governmental, non-residential, community-based treatment and rehabilitation facility. We are charity number 449. Unfortunately, we do not have brochures to give you, but we are facilitated by trained counselors. They're volunteers, but we have them in the substance abuse field, in the nursing field, education, mental health. They're all specialists. Our focus is really on helping individuals and families who are experiencing substance abuse and other related challenges. We cater to children, adolescents, and adults. We operate 5 days a week, Monday to Friday, but we have lessons for our children who need academic assistance on Saturdays facilitated by one of our counselors. Our services, assessments, counseling, both individual, family, and group sessions. These are like, the addictions, gambling, etc. There is always drug testing, random and referred to the laboratories. And here I have to thank Alison. We are coming back to you again because we know that best practice means that we have to have random drug testing. All right? The OAS, sir, and Ms. Watson, you're accustomed helping us out with the kids. I'm coming back to you again. All right. After our counseling, we do our follow-up or our continuing care for our clients. Remember, we are non-residential, so we're not like Allison, they don't live there. We see them once a week, so we have to do that follow-up to make sure after our treatment plan has been completed that they're still on the right track. We also offer counseling for mental health challenges. You recognize that since 2019, 2020, with the COVID, we are experiencing challenges. We also have the Employee Assistance Program, or our EAP. We help employees experiencing substance abuse and mental health challenges. We assist in them maintaining their jobs, maintaining jobs while working and trying to work on their challenges. We also make presentations to the workplace. Now, the workplace either invite us or we write and said, we can do X, Y, and Z. When can we come? And we try to give them a prize. There's also the family support program, strengthening families and relationships. We do have this under a registered psychologist whose focus is on family therapy. All right. We have rehabilitation, where we encourage use of support groups like NA and AA for our clients. We have to outreach to schools, churches, or faith-based, as you mentioned yesterday, community organizations with sporting or whatever, and some government agencies. We also have an online webinar which we put in place since COVID for our parents. And these are parents of our young ones, but they also bring in some of their friends or relatives. Our programs then, this is the group programs. We have the CICAD program, or Children's Education and Prevention Awareness Group program. This is similar to the Project SOLVE, but ours is non-residential, and the children are from 5 to 12 years of age, that primary level. The Teen Development Program, which is for those 13 to 19 years of age, which deals with character building, those who are at risk of using substances or already started. And Betty, we're coming back to you because you partnered with me recently. I'm coming back, so you know we have no money. Then we have the anger management, the anger management program. This is both individual and group. Everybody's angry at everything, so we need to have that one in place. There's this special therapy or the STAR, which Makeda used to work on with us, and I'm looking to restart that. We also do give back hours for the university and BCC students, accumulate their hours, because if you're going back to UVA and you're not paying any money, you have to show that you are actually working for your money. So we're taking these students and we train them and they help assist us with our work. Then we do the placement, which is something different for the UWA, BCC, and Earlston Teachers Training College students, especially those who are doing their master's degree program. We have in-house training for our counselors, and we also have training from NCSA, from ISAP, and the Paloma, and I cannot remember the rest of that, but we do that. How do we get money to do all these things? We get a quarterly subvention from the government of Barbados, and we seek assistance from corporate Barbados. We partner closely with NCSA. They were there from the beginning 23 years ago. The psychiatric hospital, the criminal justice system, which is the community policing, and we have some of them here, the magistrates court, the juvenile liaison scheme, the probation department, the primary schools, the secondary schools, community organizations, and the general public. And some of our clients are either family referral or self-referral. We do walk-ins. You can call on your telephone and ask for help, and the general practitioners also send us referrals. Now, last year, we partnered with the polyclinics. The psychiatrists in the polyclinics, they know the mental health part in the polyclinics.
Ms. Griffin, you have 1 minute remaining.
Yes, please. So we partner with these people. So we do, they send the clients to us and we send clients to them. I will keep it there for now because I have 1 minute because I want to remind you, I set up something at the back this morning to show you that therapy works, rehabilitation, treatment, everything works. There is a house at the back and there's some jury boxes. This is what clients can do after they've been through the treatment. Instead of going back to the substances, they find something profitable to do with their time. I did not bring the paintings on the trauma. Thank you so much. Any other questions? You can ask me later.
Thank you so much, Cheryl. And we go on to Street Gospel Ministries with Steve Skeet and Stephanie Skeet.
Thank you. It's very good to be here. Appreciate the privilege and the opportunity to talk about the ministry of Street Gospel Ministries and what we do. We did have a few slides to show you a few, but apparently we're not able to run that for some reason. So let me say then that Street Gospel Ministries is a registered non-profit company and a faith-based ministry. And this organization exists primarily to promote the Christian faith while simultaneously offering several vital social services aimed particularly at homeless men. That's our target group. We work with men who are homeless, men on the streets. Among the services that we offer are housing opportunities, benevolent initiatives, work programs, and mentorship. Let me start first with housing. The men who seek entry into our homes, we have a house that we call Street House, and the men who seek entry into the home, they're informed that we offer, or what we offer is an opportunity and not simply accommodation. Our residence is not intended to be merely a place of comfort, but a facility from which individual men can begin to rebuild and to reorganize their lives and replace all the negative habits with new and better positive and practices. So we invite prospective residents to view the home and not just as somewhere to settle, but a place from which to chart a new course for a stable future. So we offer opportunities to men to improve their lives through housing and not just offer them a place to, to rest their heads. And then there's benevolence. From our inception, we have always emphasized meeting the real and practical needs of those whom we engage. Those who seek our assistance have primarily residential, financial, and educational needs. And among street dwellers, the majority of whom are men in Barbados, they also have nutritional needs. And so with support from collaborating agencies, we assist in helping persons find funding for suitable and affordable housing, as well as basic food and personal items, and also to look after themselves. We have a fund which we have set up to help women as well. We help them with their first 2 or 3 months' rent to get them started off, and we try to get them settled into comfortable housing where they can work with their children and so on. That's primarily for the women. The men, we treat us slightly differently. We have a work program, and the work program is to foster traits that are healthy in the men in our homes. We want to help men understand their responsibility and bring them to a state of self-sufficiency. Our ministry is essentially and deliberately centered around contract work. Unlike my sister here, Cheryl, we get those subventions from government. We work for our money. So we have several work contracts which help us to support our ministry, but also to support the men in the program. Right. This allows men in residence to become involved in meaningful activity, to learn valuable skills, and begin the process of earning and providing for themselves. We insist that our residents secure meaningful and sustainable work, and that they spend wisely and save diligently towards their future. So all the men in our program, all the men in our residences have an account. They have a job. We make sure that they have a job in their work, and they learn how to become self-sufficient. They save their monies, and when they leave the house, they can go on to and have something that is built up for them. In fact, I must tell you that we have had men who have actually started to build houses while living in residence. And some of them have left and gone directly into the residence that they've constructed for themselves. And then there's guidance. Our role in the lives of those who we serve is simply to assist them with finding purpose, direction, and meaning in their lives. Remember that the men who come to us come from primarily 3 sources. They come from prison, they come from drug rehab, or they come from psychiatric institutions. So our job is to help them to find a direction for their lives, meaning for their lives. And we do this by helping them to resolve some of the challenges and the difficulties that they face as they recover from addiction. They recover from incarceration and from institutionalization. Some of them have, in fact, most of them have personal trauma and concerns relative to family and children, particularly the ones who have been incarcerated, they're separated from their families, they're estranged from people that they know. They need to begin to rebuild. They have difficulty reconnecting with the mothers of their children, their families. We want to help them with that process. A large percentage of the men we serve have been incarcerated. They've been treated for mental or substance abuse problems. There are issues in their lives. So our goal is to seek to bring out what is best in the individual male in terms of their talents, in terms of their abilities, to measure on the areas of strength. A lot of the men who have been in prison go on to do their work in CXC and educational matters. They learn skills, and some of them turn out to be quite useful people in the society. We want to promote them to a high level of self-confidence, resilience, a positive outlook on their lives. We want to give them something to look forward to. And that's what the program in the house is intended to do. They have counselors. We have a registered psychiatrist who looks after the men and their mental needs, and they're treated carefully, and they're treated deliberately for the problems that they present when they turn up. So we work with them through their difficult periods, supporting them in their struggles, and applauding them when they succeed. In closing, one of the lessons that we have learned in our 30 years of ministry and working with the homeless is that agencies working in the area of drug demand reduction achieve greater and longer-lasting results when they work together. We have also discovered that when ministries work within their field of expertise and they cooperate and share resources and useful information in a timely manner, that this is it's the best way to work in a rewarding situation and for ministries to work and help and to serve each other. I'm glad for the NCSA. We've worked with the NCSA over the years. They've been very helpful to us. I hope we've been helpful to them, but they've done a lot of work for us. They've supported us, and because of them, we were able to do some of the work that we do. Thank you very much.
Thank you, Mrs. Skeet. Thank you, Ms. Griffith, for the work that you continue to do as part of civil society. Continue with Jorge Oliveras, who's joining us virtually. Yes, sir. Over to you for your 10 Power Pop minutes.
Okay. And the next one.
Or if you're assigned to make the presentation, go right ahead, sir. Let us know your name and accept my apologies.
Vale, Jorge, empiezo yo entonces, ¿eh?
Sí, es Oriol Escurias.
Sí, Oriol Escurias de Proyecto Hombre España. Buen día.
Jorge Escurias from Spain. Good morning, and to each one of you, to CICAD. And I'm got straight to the point. I come from Spain. I'm registered at the OAS, and I've done a lot of collaboration with Americas. First, we recognize this demand, and civil society can be a useful instrument to achieve these goals. We can collaborate more. I think that we are obligated to that, and since the problems with drugs are require complex solutions, what is good to rely on the organization of civil society. First, we have accommodated. We have a lot of expertise implementing prevention programs, reduction of harm. We work with prisons, alternatives to imprisonment. Many of these institutions have a good wide coverage in the territory, and my organization has a staff of 2,000 professionals with more than 200 services for the country, and we train them. We conduct research, and we participate in the formulation and evaluation of policies. So I share with you, in my opinion, there are some of our main strengths. Our mission is a long term. We remain with. Many of us remain, although we have adapted. Governments change, and they change certain policies. Sometimes we can offer durable commitments, and it doesn't matter what party is governing the country. We have a lot of information, and we have evidence of the realities and the needs of persons. Therefore, you can count on us. This knowledge to better guide your strategies in the production and reduction of the demand. Because of our nature, we are more agile, and we have very little resources. We can achieve a lot. We can also be messengers, facilitators, or between the society and the government in both directions. For example, to reach agreements or certain measures which could be better assimilated by citizens, and we activate the we do it trying to get resources of output type from other sectors and from the society, because only with public funds and as we have because we all agreement that the funds do not reach to cover all the objectives of the public funds, and we have a lot of volunteers as well too. All these spaces at an international level in which I participate will be in Europe. My region, from my point of view, is one that comes close to the idea is the Forum on Drugs of the from the social civil society. It's an organization which was the European Union started to support the training and creation of policies through dialogue, structured dialogue, and through between the state and the civil society. The law obliges us to proceed this way. We have programs participating actively in the design of programs. We are 43 institutions that are very diverse, and we work for a period of 3 years. And I have the honor to have the vice presidency. I am at your disposal that you can consult me with our information, if you want information about our mandate and the characteristics of our country. I just want to thank you and warm greetings from Barcelona, Spain. Thank you very much.
Thank you, Oriol Escudias. I got you covered, sir, from the Men's Project. Thank you for sharing. And we move on to Jorge Oliveras from FLAC. Sir, are you on? Yes. Over to you, sir.
Put up my presentation, please.
Sure. Presentation will be mounted shortly.
First, I want to thank the CICAD and to thank Barbados for being here. And I think it's important to be able to present the work that we have been developing as a federation, a Latin American federation. First is to tell you that FLAC has 14 countries that are active currently. We have 50 communities in our 14 countries. This international federation is operating in the countries that are active actually currently. The FLAC has approximately more than 30,000
si puedes hablar un poquito más lento para los intérpretes, por favor.
If you can speak a little bit slowly to help the interpreters. They were saying we have a reach of 1,552 people. We have been developing several projects with the support of the CICAD, within which we can mention a guide of best practice standards, which is a historic relation of the other model, which we not only touch on aspects, the things that we should do, but we dedicate on points. After we have a diagnostic mapping, which will permit us to have a survey, and 78 countries, which permits us to have a more current vision of the gaps that exist in all the region. Although we have nowadays we have professionalized, we are working based on scientific evidence, and we know that the equipment, the things require permanent training, constant training. Likewise, once we've had all these data, this information, we create a project that we've been developing since 2013, the seal of quality FLAC, which takes into consideration all the essential criteria. Nowadays, this seal of quality has like a manual of procedure, and And this seal of quality has 56 criteria divided in five areas. Likewise, FLAT is generating a process of training, continuous training, since it started, creation awareness programs to be able to implement this seal in several countries. Once we achieve this training, and we started in 2024, nowadays the phase of implementation in several of these countries where we have virtual meetings and present with the therapeutic community to help them to take on board this quality seal in the region, and finally to be able to comment to let you know what we've been doing, is to be able to know that this year the Federation, the Latin American Federation, is going to have the 18th World Congress, which is going to be held in the Dominican Republic in Santo Domingo, and the 5th, 6th, and 7th of November, where we will be able to, we have, I don't know if I'm.
Sí, aquí estamos tratando de avanzar con la presentación.
We are trying
Dame un segundo.
to proceed with your presentation.
Next slide, please. Ahí está.
A lot of echo here. If you can go back a little bit. Just so I can talk about the last stages that the steps we've been developing. Continue the next one. The next one. The Federation have been implementing that have been in the several countries. Obviously, this is a topic that is a problem. There's a problem of resources, and we have to change the modalities, and we have to share with in-person training. We have been able to link with the therapeutic community, and we've been working online. We have two in-person training programs in San Jose in Brazil, and it is Ciudad del Este in Paraguay, and we hope to be able to carry out the next week of the first week of September in Montevideo and in Buenos Aires. Montevideo is Uruguay. As I was saying, in this case, we have been doing, we have development levels. This is a process in which FLAC is leading currently. As I was telling you, last year we had the possibility, next one, we had the possibility to develop in Campina, the Moral Congress and the therapeutics in this year, the 5th, 6th, and 7th of November in the city of Santo Domingo, the Dominican Republic. We're going to develop the 18th FLAC of the therapeutic community with the seal of quality and for the service of to transform this to have social transformation. As you can see on the slide, we have a lot of sponsors that will be helping us in this conference, and which we can have in the Autonomous University of Santo Domingo with the Dominican Republic government, and we hope to have 315 persons for this conference. The commitments that we have achieved last year to be able to generate this conference, which will be absolutely and totally free for all the affiliates of the Federation and here in the Dominican Republic, CICAD. So that we hope to see you and hope that you can come. Thank you very much.
Thank you, Mr. Oliveras, for your presentation. I want to thank yourself, Oriol, Steve, and Steve and Cheryl for your presentations and your continued work in the area of drug demand reduction and treatment. Thanks for being here with us in person and virtually. And at this point, we stick a pin in our day's proceedings so that we can enjoy lunch together. Those of you who are yet to confirm your departures, and those delegates in person, when you return, at the back, Audrey Ashton will be there with the documentation for your confirmation of your departures. So please be sure to at least come back in 5 minutes before 1:30 so that you can confirm that information. So that's it. I'll see you back at 1:30. Do enjoy lunch and the rich conversation as well. We are back. And we are ready to continue. I just let Carrie Moore have a seat. No, don't worry. Take your time. Take your time. Yes.
Recording in.
I'm not seeing them as yet. I'm not seeing them as yet. Yeah. So we continue with the workshop recommendations of the 26th meeting of CICAD's Demand Reduction Experts Group to address current hemispheric challenges. And to offer these recommendations, collaboratively we have Alison Gotip, the Clinical Director at Marina and Verdon House, CIS, and Ms. Betty Hunt, Chair of the Demand Reduction Experts Group and Manager at the National Council on Substance Abuse. So I hand over to you. And Jimena joins at this time of that. Yes, and Jimena will be a part of this process as well. The Demand Reduction Unit Chief, the Executive Secretary of the Inter-American Drug Abuse Control Commission. Now, are we blending both the two segments? Let me show you the agenda. Yes. All right, so over to you, ladies, for the recommendations.
Bueno, muchas gracias. Es tradición que...
Thank you very much. The tradition is that when a country assume the presidency of the group of experts, in addition to the conclusions of the meeting, they also produce this a document. And at this time, Barbados is going to work with Barbados to share their proposal in terms of results. And we're going to propose we're going to present this document for discussion among the countries. They've prepared it. There are some issues that have been discussed during these 3 days and others which have not, but which are also relevant that we were going to take into consideration in the area of demand reduction. So during this segment now, we're going to work on that with Betty, Alison. Betty has some difficulties with her voice, so perhaps she will not be able to talk very much, but Alison will also assist her to reinforce what Betty wants to discuss with us.
So thank you. Good. Can you hear me? For the interpreters, are you hearing me okay? So I've asked Alison to join me because, yes, I'm having some problems with my voice. As Jimena said, Barbados was tasked with coming up with some recommendations for the way forward for next year. Chile will be chair next year, and so Chile will be in a position to guide these recommendations. However, these recommendations were articulated based on the agenda, but as a result of some of the discussion that we've heard here, I thought it would be fair and more balanced to try to include some of the issues that were raised here, to review the recommendations which were previously circulated, to compare what came out of the discussion here, to see how we can edit these recommendations to make them reflect the needs and the challenges, the desires of the countries represented at this meeting. So once I've said that, I'm going to turn over to Alison, and she will start with the first recommendation which we had, and then give a suggestion. And this is open for discussion, so I hope we have some robust discussion. I will take notes, and where edits are to be made, I'll make them and email and get them to you over the weekend so that then they can be disseminated in short order. So thank you.
Thank you, Betty. Thank you, Jimena. Good afternoon, everyone. So as Betty noted, these have already been circulated, but just to re-emphasize that the first recommendation made by Barbados is to establish a criteria for national and regional accreditation of drug prevention counseling, recognizing that there are different levels of certification, including grassroots levels. Right. The reason that we understand that to be imperative recommendation is that we understand that it's public health strategy, but there is some inconsistent training and ethical practices among some of the counsellors, and this can obviously undermine the effectiveness. Without clear accredited standards, practices can vary widely between counsellors and institutions and leading to inconsistent support for individuals and the communities. So with standards, it will legitimize the field of drug prevention counseling as a specialized and professional discipline. In recognition of the fact that not all persons can access formal institutions of learning, this recommendation will serve to bridge the gap between ProSER and the need to provide and sustain a credential system for persons who engage in drug abuse prevention counseling.
Barbados proposed this based on several discussions that we have had with member states, particularly in the English-speaking Caribbean, with respect to anybody being able to offer themselves as drug counselors, and in a lot of cases doing more harm than good. And so we thought that this is something that we could pursue. I know when ProSER was implemented, it had more success, I think, in the Latin American countries than in the Caribbean because of this whole issue of accreditation by our accreditation bodies in the Caribbean. But having not heard this discussed as a real issue during the meeting, but however, what was discussed is the issue perhaps of, as St. Kitts Nevis quite brilliantly explained, finding a way to catalog and document programs. And so we'd like to propose an alternate recommendation for consideration at this time. It's not worded exactly right, but I want to capture the salient points, and then we can open it for discussion and perhaps come up with a properly worded recommendation.
So as Betty said, we're looking at identifying prevention agencies in order to produce a manual or a catalogue of programs to facilitate accreditation of programs. So therefore having documentation of those programs, so then there is a holistic and comprehensive collection of these programs that will then lead to accreditation. So any comments on that particular point? Dr. Chase?
Good afternoon, all. I do agree with the point, obviously. I think no one in this room will disagree with that point in terms of accreditation and standards. In the treatment arena, obviously you want to do no harm, and I want the best for all of our population who may be potential clients. My concern or my question or my addition to it is that in the list and the accreditation of the training programs I think you're speaking of as well, I think there needs to, I want to emphasize the need for attention to the period of training. I find that some training programs try to pack a lot of the information into shorter space of time for the individuals, I think, to really assimilate the information in order to put it into practice. As one of the previous trainers for ProSEER, I found that was a barrier, I think, or a difficulty with delivering the ProSEER program in the manner that it was supposed to be delivered. As a result, the Barbados team would have extended and spread out the sessions over a period of time, not just for to allow persons to attend, but also to assimilate the information. And I think sometimes we try to condense these training sessions within time of a short period. Because, okay, you can look at the hours and say, okay, well, this module takes 12 hours, and then you accumulate and you say, okay, well, it's 5 days, and you want the training to be completed in 5 days. It does, and particularly with prevention and in treatment as well, there are some concepts that persons need to really sit down and assimilate and to get.
Thank you, Dr. Chase. I think your comments went back to the original criteria, the original recommendation we had for establishing accreditation for persons who present themselves as prevention counselors. So we can discuss whether we keep that recommendation and also add a recommendation, the new recommendation for producing a catalog of programs. And when we say producing a catalog, we will have to be guided and informed by the same set of standards as CICAD described. So it would have to be very rigid, will have to be replicated, will have to have some measurement and evaluation in place. So yes, I take your point. Something else that has come to our attention recently, and this is because there is no accreditation for prevention counselors. You're right, I can go online or wherever, take a 2-hour course and hang up my shingle as a counselor. There's no minimum standards. And I think we came across that quite recently, of a very short course and then offering yourself as an addictions counselor, and it is very dangerous. So it is something that we would want to look at to see if we keep the original recommendation for the certification of counselors, the persons, but also see how we can establish some system where we can catalog programs, test them, and add them to that catalog as we move along.
I think I don't see it actually as two different points or two different processes because they're linked. In order for you to accredit persons and to say, well, you are qualified or certified as a prevention practitioner or a treatment practitioner, your assessment or accreditation of them has to do with the program or your assessment or accreditation of the programs that they would have done. So like, it's not a reinvention. So like most registers, certification registers, let's say the Canadian Board of Physicians or the UK or anything, they will have on them, as you said, a catalog of programs that once you've successfully completed and passed these programs, then that makes you eligible for certification to practice in a particular region. So I do think that they are linked and they are equally weighted and dependent on each other to ensure that, as you said, we maintain a standard of care for the persons that we are here making sure that we are protecting and helping.
Dr. Chase, I note your point. I'm going to come back to that, but I'm going to give the floor to Emena and then to Francisca.
Sí, muchas gracias. Creo que tal vez
I think
en este
that
punto efectivamente
perhaps in this
al
point,
parecer hay un avance diferente.
I think that there is a different level of advance between Caribbean countries and Latin American countries. At CICAD, we have been encouraging countries to, in all areas, but for particularly in the area of treatment, we need to focus on high standards of quality of care. Unfortunately, the issue of treatment of drug abuse problems has linked with, has a history of abuse and violation of human rights. And we don't want this to happen. We want the practices that are implemented in the treatment programs are based on evidence. And even we don't, although we don't deny the existence of monitors and therapists apart from medical health professionals, it is important that these persons be well trained and we have some means of ensuring that they're following good practices. So the recommendation is for each country to provide its own regulations. First of all, in terms of accreditation of programs, and then some kind of regulation regarding the skills or the knowledge that the persons working in these types of programs must have. And CICAD can perhaps give support to the countries in establishing these systems. Sometimes we put the emphasis on the training program, but the real emphasis should be on the results. What is the profile of the professional person or the therapist that they should have? What skills and knowledge do they have? I know that programs that are available are perhaps long programs in terms of duration. And this is something that can be changed based on the prior knowledge that these persons may have. So, unfortunately, today we also have the option of doing some self-managed programs online. There's a universal curriculum for training that's online for treatment, and anybody can take it. They can sign up. They can follow at their own rate, and then we can do some in-person sessions in order to reinforce certain content. But we need to look at the training and the course to identify how we are going to certify it, how we're going to be accrediting it, and what are the standards. We have international standards for treatment, and there are also at CICAD some basic rules for setting up treatment programs. And I think that we have fertile soil in order to begin to make good decisions and to take certain instruments and then to decide how we're going to achieve our objective. There are countries that have established laws from the Ministry of Health, and they've said that you can get your training within you can get your qualifications within 2 days. And then there are other courses which last for X amount of time, formal courses, and we are going to accredit this course. There are different ways of achieving accreditation and certification. And the countries make these decisions based on their culture and the amount of resources that they have. But the most important thing is that for prevention, but even more so for prevention, we need to make sure that those very vulnerable persons are protected and that we use respect and we use the best practices which are more modern. And this is something that we've done with FLAC, as Jorge mentioned in the previous session. And I'm also sure that the community of therapists can collaborate because they have looked at the international regulations and they have basically established a language for the community of therapists. And I think this is a resource that we can use for the countries, we can provide to the countries if they require that. Thank you very much.
Thank you, Emina.
Gracias.
Gracias, Betty. Pienso que sería interesante tener ambas recomendaciones y
both
compartiendo
recommendation
que
and at this in the area of treatment, there are many advances in some regulations and standards and guidelines, etc., that have become more standardized. It would be very interesting for me if I understood the first proposal. It has to do with focusing on the profile of the prevention program and the skills, the basic minimum skills. And this seems very interesting to me. I think we should have it because in general, we have training for curriculum, typical training curriculum, but it would be interesting towards to defining a profile or certain basic skills that it could be basic for formal skills, but it could also include skills and competencies that we need to provide. And I think that this would be very interesting. And I think that we can add this even to the challenges that we've been discussing up to now. And it occurred to me that wasn't arise at the moment, but I think those are very critical points. And we need to be able, and I think the proposal of having this catalog of programs is something that we need to work on to decide how this catalog would work. What are we going to include? And we need to have enough time for implementation so that we don't want to take, we need to ensure that human rights are protected. And this is the kind of work that each country should have done. But I think that we should maintain both recommendations, which are very, very valid at this stage. Thank you.
Is that St. Kitts or St. Lucia? Oh, okay. Go ahead.
Thank you. Sorry. As it pertains to the first recommendation made, I would like to make a suggestion from the Caribbean perspective. One of the things I think is important, especially as healthcare practitioners, we know there's the need for continuous medical education. One of the gaps I find existing is with prevention practitioners. That need to have that continuous education, continuous development is a gap, especially given how agile the current drug environment is, how things evolve and change so quickly. To remain current and to know what it is that may be priorities globally, regionally, and even at a national level, and to know the best practices that need to be applied to that context.
So thank you. Thank you, St. Lucia, Chile, and Emina. I've heard all the comments that were made, and I think we have to determine, and Dr. Chase, you're still there, yes, the programs must be linked to a person or to a body of persons. To me, the question is, this is almost like a chicken and egg question, but I do think as we develop programs and we catalog programs, if they meet the scientific tests, they can be easily replicated. You have your monitoring and evaluation systems in place, et cetera, we can, along with that, as a separate stream, start to see, based on, as Francisca just said, international best practices, for want of a better explanation, what a prevention counselor looks like, right? And I think that is where we are right now. And so if we can have that frame for what a prevention counselor looks like, we're doing that on one stream and almost simultaneously looking at programs that are tailored, as Emina said. The programs, even though they're there, we have to see how they suit our individual cultures. So I take Francisca's point, and if there's no dissenting opinion, to keep the two as separate. and see how we can get 2 recommendations and circulate those for just a little further discussion and come back to the plenary.
Thanks, Betty. Thanks for all the comments. We also have the recommendation to develop a comprehensive network for professionals involved in prevention education across the region in order to increase awareness and promote advocacy regarding the drug situations in different geographic regions. The context for that is, given the geographic divide and the evolving social and legislative differences within the region, it is critical that an informational hub be established for networking and knowledge transfer in real time. Such a platform would benefit not just professionals, but would ensure that community workers and other practitioners across the region can access a common source of up-to-date and relevant information. This will create a robust network for prevention education professionals, which is essential for amplifying impact, ensuring consistency, and fostering innovation in drug prevention education.
Before I open the floor for discussion, tech team, do you have this that you can put up the slide with recommendations? I think you had it, so it is easier to follow. It was put up in English and in Spanish. Thank you.
So whilst the tech team are hopefully getting that up on the screen, I hope that we understand that recommendation and we open the floor for any comments, ideas, suggestions, or any tweaks that are needed with regards to that recommendation. The floor's open.
Hi, good afternoon, everyone. I would just like, for the purpose of the recommendation, that we have a very clear but concise definition of what a prevention counselor is, because I think terminologies across all countries, they vary. So that would be useful. Thank you.
Thank you.
Any persons online that want to comment? Okay. There being no further comments, I think we can proceed. Another recommendation is to identify factors hindering access to treatment for females with a view to develop innovative and tailored treatment options. As some of us are aware from the most recent Barden report, there was indications that there's a disproportionate number of females accessing treatment for drug use. And this could be due to several factors, namely their different roles within our society, and females tend to have greater responsibility as caregivers, and therefore confronted with a serious dilemma when considering rehabilitation at residential facilities. Who's going to look after the children? I'm the main breadwinner, etc. Due to this local research, there is uncertainty about the magnitude. So we've been unable to really evaluate the magnitude of the drug use amongst females and the actual number of females who are in need of substance abuse treatment. It is therefore critical to understand issues relating to drug use among women in order to inform the development of policies that account for differences between men and women, and the specific needs of women in the prevention of drug use and treatment of drug use disorders. Any comments, thoughts, remarks as it relates to that recommendation? Moving on swiftly then. Another recommendation is to, and it's closely linked to the previous one about gender specifics as it relates to access to treatment, is also to examine the involvement of females in the drug phenomenon. The nature and extent of women's participation in the question of illicit drugs has been largely absent from the research, actions, and other activities of the UN and other intergovernmental bodies and national governments. This was revealed in a policy working paper on women and drugs in the Americas published by the OAS and the Inter-American Commission of Women in January 2014. Since then, the 2030 Sustainable Development Goals has highlighted issues related to both women and the world drug problem. Bearing in mind the fundamental roles and responsibilities of females in society, it is necessary to investigate and ascertain the involvement of females in the drug phenomenon in order to better understand the scope and impact and provide appropriate responses. Ooh. Anything from you, Becky? Throwing it out to the floor again with regards to the role of females within the drug phenomenon.
We can see it in the screen. Maybe if we could.
The screen is very blurry, not very clear.
But I mean, that's the number 3, isn't it? Or
no,
4?
That's number 4.
4.
So 3 and 4 are fairly closely linked
4.
with each other, speaking about females.
Oh
yeah.
There we go.
Hand it over to Jimena.
Sí, no veo a Pernell si está acá, pero creo que tenemos, respecto a el 4, tenemos información. Los últimos años se ha levantado bastante información segregada.
Information that was segregated by gender in different research efforts. I think, therefore, that there is information available at this moment in supply and on demand as well too, but we probably have to define better what do we understand by the involvement of women in yes, just okay. Yes, I think it's interesting, and I think that we probably should define it better. I think, and a couple of phenomena first, and probably what we can recommend is make a first document which establishes what are the main topics of concern around support of women. The first phenomena, which is in the area, the Greek area, is the involvement of women and the micro trafficking in the lower chains of trafficking, and perhaps it's the women who are more in prison cause of the drug crime, because they occupy those parts that are less important in the structure, and it has to do with the economy and also the survival, and this is an area of concern, and perhaps we don't have data from each country, what we have seen. So the access to the, of the women to treatment, which we should, but this is also a topic, and this topic, the stigmas associated with that, the topic also of how the women carry bear the recuperation, but those who are charged with the recuperation of the persons with substance consumption drug, those who are so who is kept working while the other is working. Is the woman who affect this development. Another phenomenon which we see is the numbers have been shortened in terms of the rights, especially the studies on adolescent populations. Every time more and more children are equaling the levels of consumption by and I've seen this in other countries. The difference which before were a lot more, and this is also is something that came out in the last report, the World Report on Drugs. So we have 4 large ambits where we can put this title, but perhaps the proposal is perhaps we should do we have to do some sort of consolidation of data, and if we can identify those 4, but there can be more, and we leave it open like that. Or perhaps you have the concern of something, concentrating on something in particular. I'm looking at leaving and not only look at the topic of the treatment of women, and this is a great topic, a large topic in the reduction of demand reduction. But I don't know what you are thinking of, what you have in mind.
What we didn't know is the extent to which women are involved in all the areas that you described. And we discussed this, and it is easy to overlook providing responses for persons when you don't know what it is that they want. So that responses for a woman who is a trader, who and not a user, who's a seller, not a user, may be different. So we wanted to leave it open-ended. In some territories, it may be very vastly different. What we did recognize is that the whole issue of response to females and providing treatment is structural. Where do we need to change? So rather than defining 4 areas or 3 areas or 2 areas, we wanted to leave it open, see what countries come up with, what emerges. Thank you, Alison. And then for the way forward, see how we can develop either projects or further research from that, rather than presupposing that these 4 things may be common across areas. You want to speak?
Okay, we have 7 minutes. So any further thoughts in terms of the recommendations, what have been expressed by the chair? Well, those recommendations got to be really good, leaving everyone speechless. Love it. All right, so that's it.
Imena, so what I will commit to do is to take the views that were expressed, go back and see how we can refine the recommendations and then have them circulated, if that is okay.
Sí, perfecto, está muy bien y creo que estos 4 productos son...
Those 4 products results are important to see how we are going to develop, how we're going to share and consolidate and construct with the countries. But I think that they are products, they're very important products, necessary products. And I think that it is interesting to be able to rely on documents that will give us a bit a bit more information or help us to consolidate information that could be distributed in different spaces. I see. So I think that the contribution made by Barbados is very interesting and relevant, and I think it represents the reality of the countries of the Caribbean, where there is concern about some of the topics, especially on which it is necessary to continue advancing the work. I just want to thank Barbados for having placed those topics on the table, and this included part of the discussion which we have had this day, and very probably, some of these topics are going to be brought along, or we're going to continue with the presidency of Chile. I want to thank and congratulate Barbados, because you have done a great effort as a diagnostic as well, to see what is happening, what is pending in order to advance in the Caribbean and Latin America in general, with the particular reality of the Caribbean. So thank you very much.
Ladies, I want to thank you for
Damas
handing of that session with the recommendation, and delegates, thank you for your engagement both online and in person. We are now at the stage where we have conclusions of the meeting and closing remarks. Can you believe it? We are at that stage. The three-day conference is about to be closed. So at this stage, I'm going to hand over now again to Jimena, who will lead out this process with support from Ms. Hunt as well, from Betty as well. Over to you, Jimena.
Sí, muchas gracias.
Yes, thank you very much. Thank you. I have some conclusions here, but I would like first to pass the floor to some person who are being connected or who are here in person. If you want to make any observation along the lines of closing, what conclusions you have, what challenges probably, what have you learned in these 3 days that we've been here, and I think that as was said, and at some point in time today, the world is seen better from Caribbean. I think there's something in the environment, in the warmth, probably, which makes us feel more accompanied, and it helps us as to see that the problems that we can be facing in this moment, they have solutions and they have ways of they have outs. Because I want to pass the floor to whoever wants at this moment to bring their own words of conclusion. And those also who are online as well. Juan Carlos, go ahead. Guatemala. Oh, yeah. Well, good afternoon and good evening. I think it's very important. There have been a lot learned in these 3 days, and we had the opportunity to get to meet each other and to get to know the different interventions of prevention and treatment and rehabilitation. And bearing in mind also the situation and where we find ourselves currently, I think it is important because this makes me think that in all the world, the prevention experts around the world, they have perhaps they have the idea of presenting and they have taken note of our efforts in these countries. So not only to present, but also to be able to give lend a hand support to those countries and to make these interchanges, which it's proven that the world is not so too distant from each other in terms of the abuse of these substances, and it shows that we can realize that that there are ways that our neighbors, we can understand what our neighbors are doing, and we can take advantage of that and bring those to our experience and share, and we can join hands to seek solutions. Thank you very much, Juan Carlos. Fiona, Antigua and Barbuda. Go ahead, you have it.
I want to express gratitude once again to OAS CICAD, along with my colleagues in Barbados, for putting on what I believe to be an excellent bringing together of the minds within the region and within Latin America. As Dr. Novia said today at lunch, she thinks that the level that is expected after this has really set the bar extremely high. But in addition to that, I strongly support the recommendations and would also emphasize the importance of the research that we would have seen demonstrated by our sister states such as Grenada and Jamaica, and the importance of us integrating those types of studies within our own countries to ensure that we have a really good reflection of what is happening within our different populations. And so I'm super grateful for the opportunity. I know that our challenges are similar, and so when we come together in settings such as this, it reminds us that, we're not the only ones struggling. We're all trying to figure it out. We're all trying to see what the resources would look like, even when the resources aren't there. So I'm really grateful for the strong recommendations that have been made in the last 3 days, and I do believe it is a strong way forward in developing us further so that we don't necessarily have a repetition, but we actually have actual momentum happening within the region. And looking forward to Pernell's continuous support as it relates to strengthening the observatory. So thank you so much again, and it has been a pleasure.
Muchas gracias. Sí, Natalia de Colombia.
Thank you very much, Natalia from Colombia. And now I'm going to go over, and then I will go with someone who's connected online. Thank you very much.
I'll start in English just to thank Barbados for their awesome hospitality, for organizing this meeting, providing us with so many important input to bring back home, and also to contribute to the work of the OAS, and especially to the discussions that we are going to have next month on the hemispheric plan of action that is being negotiated. And I wanted to refer to the proposal that you made of our recommendation, and I think that is something that talks to the discussions that we're having in the negotiation of the hemispheric plan of action, because it is highlighting, and that I'm referring to the recommendation on the women aspect of drug related issues, is talking to one of the things that we highlighted in some of the discussions that we already have in the hemispheric plan of action, and it is the need to incorporate a gender perspective in our work. But we saw continuously proposals for that perspective to be deleted entirely from the plan of action. And we do believe that this kind of dialogue that we had today especially highlights why we need that when we talk about drug issues, why we need to consider the needs of women in a different perspective than men. And in that regard, I will also like to ask for the consideration of this recommendation to include specifically the need to incorporate the gender perspective in drug policies. Maybe at the end of it, when it says better understand the scope and impact and provide appropriate responses with the gender perspective. From our point of view, when we talk about gender perspective, that's not just a word. It's a recognition that women interact with the world differently than men, and that you need to assess both of those ways in order to understand how to provide appropriate responses, how to design public policies, and what I just want to and I ended up speaking in English the whole time. I'm so sorry. But I wanted to say that for me, sometimes it's easier this way because I don't want anything to be lost in translation. And what we highlight as Colombia is this is an issue that needs to be in the center of our discussion, that needs to we cannot erase it because it's not going to disappear. So just again, thank you so much for all of these discussions.
Muchas gracias. Vamos a dar la palabra primero a
We're going to go the
Gloria
floor
Torres
to
de
Gloria
Salvador,
Torres
que
from
está
El Salvador,
conectada
who
online.
is connected online.
Hola, buenas tardes
Hello,
a
good
todas y
afternoon,
todos. Muchas
everyone.
gracias.
Thank you very much.
Sobre todo a la
Jimena,
presidenta
especially
CICAD y a
thanks
todo
to
el
the
equipo
CICAD and the OAS and the team who is in charge of this. Jimena, I thank you from El Salvador for those tools so that we can advance in these topics. I am very happy with this meeting that we've had. Despite the fact that the group is virtual because it highlights the prevention based on evidence, highlighting the importance of the prevention is a science and how, in spite of the particularities that we are encountering in different countries, we can come together and we can help each other in spite of the differences that each has. Based on talking about our different realities, I want you to know that in Salvador, we are always here with our shirts on to support any recommendations that were taken, and we can continue learning and raising awareness. Thank you very much to all of you and all the participants. Thank you very much.
Muchas gracias, Gloria.
Thank you very much, Gloria. I'm going to pass the floor to Lisa Riviera from Argentina. Thank you very much, Jimena. I just wanted to mention that on behalf of the Ministry of our Ministry in dealing with drugs in Argentina,
a la CICAD, obviamente, y al gobierno de Barbados por la organización de esta reunión, y a todos los colegas. La verdad que ha sido muy interesante.
And to my colleagues, I wanted to thank you, and I'm happy to have shared these 3 days with you.
También creo que
Also,
justamente lo
I think
que
it
hemos
is
podido
what we've been able to confirm
de estas reuniones
in this meeting.
enfrentamos desafíos
We know that we have common challenges on the topic of prevention, and we are all interconnected. I wanted to thank you, and
de conocimiento, de compromiso y de voluntad de cooperación.
And you can count on our commitment to participate, and we will continue working. And based on what will be presented, you have especially the one that has to do with accreditation of the person's trained. So we are prepared to continue working with all of you, and I want to give you a big hug from our part. Thank you very much.
Luca Roncati de
Luca Roncati from pleasure to meet you. I'm calling from Brazil, from FLAC. I want to thank all of you and pointing out the importance of this meeting and the importance of the interventions that we've had. Thank you very much for your work and for the opportunity to start to be here with you.
Muchas gracias.
Thank you very much.
Karimu.
Karimu.
I'll yield to Troy for now because I think he had his card up for a while.
Yo creo que él tenía la petición de palabra.
Thank you. Good afternoon again. What I have learned, we are all from a relatively small part of this earth, despite the language barrier. Despite the language barrier, cultural nuances, we are all faced with similar challenges, similar problems as it relates to the drug phenomena, drug demand reduction, treatment. And for me, collaboration is not just helpful, it's a necessity. Sharing information, sharing knowledge, sharing experiences is the only way we as a collective can overcome these challenges. It's important to meet in fora such as these as often as possible. I know that COVID has passed a few years and it has derailed the efforts of collaboration and engagement. Meeting face-to-face yield, in my opinion, greater outputs than meeting online. Actually seeing a person, being able to take out the phone and say, well, look, I know Pernell. I can call Pernell. Pernell know who I am. We communicate. We have all our sidebars at these meetings. The value of that can never be replaced. And it's important for us not to just come to these activities, these sessions, these conferences, and just talk. It's to take back home the information, the experiences, see how best we can implement them, and see how best it can work in our own backyards. See what tweaks we can make so that when we come back next year, next month, we can say, well, look, this is what worked for us. Can it work for you? So therefore, I would encourage everyone to continue the collaboration, share experiences, and implement what works best so we can yield the greater results. So I look forward to meeting with you all again in a different place and at a different time to share our experiences. So thank you, and thank you, CICAD.
Muchas gracias, Troy. Ahora sí, Karemu.
Thank you very much, Troy.
Thank
Now,
you so
Karen,
much for the floor. On behalf of the government and people of St. Nevis, I wanted to make sure that I extend our profound gratitude to CICAD and Jimena and her team for their oversight and the executive coordination that they have provided for the continuation of these demand reduction expert groups. Troy already brought it home that there is something different about being in person and being able to brainstorm among like-minded individuals to help us better process our plans, our strategies, learn new insights. And so I thank you and your team. Please extend it to Alfonso and Isabella, Angela, everyone, for the hard work and dedication that you have extended over the years. I also acknowledge and appreciate Chile. I know Francesca, after Harbor Lights, is saying, no, Chile is not like Barbados, but the level of substance and critical thinking you brought to our workshop, it's already showing us what we can expect, the level of substance we can expect in Chile. So it's not a comparison. So don't look at it that way. We do look forward to what you will be presenting next year, and I do acknowledge your support as vice chair this year. To all the participants as well, your camaraderie and support, we are truly grateful, and we look forward to the continued collaboration. Now, St. Kitts and Nevis is here because of the amazing support of Barbados, and I must say thank you to Betty and your team for an exceptional experience here today. Not only in the, I know we all want to highlight Harbor Lights and all that good stuff, but you brought a different structure to the meeting, including the workshop, and I think it was very effective in helping with a forward thinking and planning and processing. So I really commend you and your team for that slight change that you introduced in this meeting, and I really hope that this continues moving forward, that we'll have that time to really interact in smaller groups so that we can process and plan as we move forward. And I could not come here because if it wasn't for you, St. Kitts and Nevis would not be represented in person. So I could just have a quick second. We brought a small gift for Barbados. So Betty, if you could just please meet me to the front. And thank you again to everyone. This has been an amazing workshop.
Muchas gracias, Karimou. ¿Te falta algo?
Thank you very much, Karim. Is anybody else? Karimu?
Yeah, okay, thank you.
Yeah, you finish? Okay.
Allá atrás, Barbados también.
Barbados also.
Good evening. I'd like to continue the sentiments of my other participants in the sharing and the knowledge sharing, the experience sharing, the acknowledge of our common problems and common goals, best practices, and obviously meeting in person. I think it's different to just being online, and I think it gives a richer discussion. Following on from my colleague from Antigua, who would have said as well about best practices and research and coming together, I would like to leave this point or this suggestion to all of us, Caribbean nations, CARICOM nations. I want to revive the concept that was previously spoken about, I think about 2 or 3 years ago, of a CARICOM observatory. We speak about coming together, we speak about sharing knowledge. I think there's a lot of value in having an observatory amongst our Caribbean nations. And therefore it would help, in my opinion, to bolster each other, all of our Caribbean nations, and add richer content and material information to the World Hemispheric Report, for example, in collaboration, obviously, because it would go in collection with what's happening within the Caribbean context, with the observatories within South America, Central America, and North America. So I would like to put that on the floor and hope that we can take it off the floor and make it a reality. So yet again, CARICOM Observatory on drugs. Thank you.
Muchas gracias.
Elizabeth Yopal.
Thank you very much.
Thank you so much. Good afternoon to everyone again. And it would be rather remiss of me, like my colleague Karimou, if I did not choose to speak. At one point I thought I spoke enough for the 2 days before, so maybe I wasn't going to speak. But I think I cannot go back home and not say thank you, thank you, thank you. Like Karimou, and all of you, my colleagues over the years from 2009 to now, you know that whenever a workshop is not funded, I cannot attend. And you all know I like to interact and hug and kiss and all of that. So the online format is good, it serves its purpose and it works at times, but I'll repeat again, nothing could be compared to an in-person meeting. Especially too, I got a lot of compliment, Pernell and all of you, and I'm saying to myself, wow, because you may not know it, but there are times when I become very despondent. Despondent to the point that I contemplate maybe retirement, because you do this job, you're passionate about it, but sometimes you do not get the support, and it could be very daunting. And I must stress again, and it's not because I just want to talk. When I say that my office has zero budget, I don't mean $50,000 is not a lot of money. I mean zero as in nada, no, nil. Because a lot of people think, oh, I thought you meant you had $20 and you wanted 30. I mean, the only money we have is our salaries. So there isn't a dollar to buy a bottle of water. However, when I meet you, when I collaborate with you, you make my work much easier. Just seeing you, hearing you, and the little compliments, it's not like I thrive on it, but I appreciate it when people will say, oh, you're doing a good job. I hear it here, you know? And I deeply, deeply appreciate being able to come here to get that reassurance that I'm not alone and that one day what is for Grenada is going to come to Grenada. That's my hope, that it's going to come to Grenada in its right time. So again, thanks for having me. I am a little bit under the weather. We had a lot going on just before over the last few weeks. Again, very small unit. We had 3 activities. We had the Michigan University from the US, Pennsylvania University. We're working on the national drug policy. I'm engaging with the local university to do some research. So I think my body sort of broke down. It was a lot going on for the last few weeks. But this was reassuring. And whatever happens in Barbados stays in Barbados. Now, last night was very therapeutic for me. I don't want to see it on Facebook, though. You would not imagine how much stress it took off my shoulder. So hence I was at the front of the stage. But let's leave that there. But thank you guys very much. I love you. And you do not underestimate the impact you have on my psyche. Thank you so much.
Muchas gracias.
Thank you very much.
Chair of the chair.
Good afternoon, colleagues. It is indeed for me a profound pleasure to see so many of you around the table. In my opening remarks, I think I suggested that in Barbados we work hard, but we play harder. And I think the experience of last night proves that. I really want to thank you all for being a wonderful group. It was Barbados' pleasure to accommodate you, to welcome you, to facilitate this wonderful meeting. I have personally learned a lot. I wasn't here for the full 3 days, but most of the 3 days. And I'm sure that my fellow board members who attended the opening were impressed with the attendance, and though they will hear more as we go forward as to what took place. I want to publicly thank Betty and her team for wonderful arrangements. We on the board were saying, we're willing to help, we're willing to help. And they allowed us, but it was really Betty's show and her team. And I'd like to, again, to publicly thank her and her team for the wonderful work, the organization, and putting it together. And I want to thank you all for not only attending, but for providing substance to the discussions. Just before lunch, I was speaking to the photographer at the back, and he was saying how wonderful it is that it is much better to have people come together and meet in person rather than to do it online. And if he recognized that, I'm sure I've heard that sentiment expressed by several of you here. So I hope going forward we can have more of these meetings where we can actually come together and led by the persons Chile who will take over as chair going forward. We pass the baton to you. If I had one of those balloons, I would have handed it over, but it's an imaginary handed over. We thank you all very much for everything. And I thank you all again for coming to Barbados and having to make this a wonderful event. I always believe in 3 things: cooperation, collaboration, and caring. And it is clear to me that those 3 things have been exhibited over these past 3 days. So again, this is not Betty summing up. She will still do her own thing. But I thought that as chair and on behalf of our minister, I should perhaps comment that the minister and the people of Barbados would like to have you all here. We look forward to doing it again sometime, more work, Betty, but in the future, if we get the opportunity, we'll endeavour to repeat or better our performance. And I commend the future gatherings of this body again. Thank you all very much.
Muchas gracias. Bueno, voy a dar algunos agradecimientos antes de pasarle la palabra a la vicepresidencia y luego a Betty para el cierre. Bueno, agradecer a Ángela Crowdy que nos acompañó en el inicio. Ella ya está de regreso. Asumir muchísimas funciones en este momento, así que les manda un cariñoso abrazo y además nos felicita por haber tenido
and she congratulates us for having had this meeting. I also want to thank Pernell, who's taking photos at this moment, to the Inter-American Observatory on Drugs, with which we have a very close working relation and which has managed to be with us in the 2 last meetings of the group of experts, and their contributions have been extremely valuable, and they help us to have continuity in the work that we're doing. Of course, I want to thank Alfonso Abarca, who could not have been here, who was unable to be here with him. Thank you so much, Alfonso, my friend. You should really turn on the camera so we can see you. Where is he? Where is Alfonso? There he is. Hey, Alfonso. Come on, Alfonso.
Te echamos de menos, pero he tratado de representarte bien.
But I've tried to represent you well. Not as well as you, but thank you so much, Alfonso, for all of the work that you've been doing for many months. You've been taking care of all of the details that we can say in terms of the planning and the organization. And Alfonso was the one who was maintaining the rhythm of the organization. And he had a great team, Adriana Montano, who was seconding him, because there's so many aspects in terms of the details that they had to organize in order to have a meeting like this. And I want to thank them for their love, their dedication, the concern about maintaining contact with every one of you. And I think it has been an excellent job that you've done, Alfonso. So congratulations. And I hope that you feel much better soon and perhaps you'll have some days of rest. I'd also like to thank the rest of my team, Isabel Araujo, who is going to be a mommy soon and who has been working so hard in spite of that. At any time of the day, she's been working very closely, working with the Caribbean countries. She's going to be out for a few months on her maternity leave, but we have the rest of the team that will be supporting us. But she has also been very involved and supportive of the organization of this event. And the rest of the team, Andrea Escobar, who has been working intensely on the issues of gender and faith-based organization. Jose Luis Basquel, who has given us professional support, academic support, and scientific, and he has trained so many of us and who has been in all of the countries that we've been working with. And Maria Garcia, who has supported her with her smile, her cheer, and her good spirits, and she's helped us so much with the administrative work, which is so difficult at times, and it's not as fun as meeting here. Of course, I want to thank Betty, because from the beginning, even last year, when she assumed the presidency, she took this very serious, and she was taking a look at all of the details to see how it could be done here. And it has been a pleasure to work with you, Betty. You have really made our work much easier. And this is something that I was saying to Alfonso. And we also noticed your dedication and your commitment, your love and your warmth. And I also to recognize the whole team that's been working here in Barbados since we got here, the interpretation, the transport, the food, the audiovisual team, the translation, to our moderator. Bravo, fantastic job. Alejandro, I baptized him Alexander, a name in Spanish that has nothing to do with his real name. But when I met him, I thought he was the person in charge of security. But he has made us feel very safe. And he has kept us really strictly maintaining the timetable. And and it's been really fun discussing all these issues with him. And to all the authorities of Barbados who have been assisting us over these days and who have been supportive of executing this activity, I think that every detail has been executed perfectly. Everything has been well taken into consideration. We felt very comfortable, and we also felt free enough to express our opinions or different opinions. This modality that was Barbados proposed of have an aspect focus on exposition and teaching, another part which is more participatory, and this has had really good results. So I just want to tell you that I thank you. I felt so happy with, in spite of the challenges that we have, we're going to keep in contact, and I hope to. I'm going with my heart full and my stomach too. So I'm going to hand over to the Vice President. Thank you very much, Jimena. I want to begin by expressing once again thanks to Barbados. I believe that we could have been for days, we could spend days thanking you because the amount of love, the treatment, the kindness that we've received is really impressive. And in terms of the generosity for sharing this space with the Vice President, which the nominee doesn't happen. It was a decision that you took so that we could work collaboratively. And I think this is a word that we will take with us. And I want to thank you, Betty, and your whole team for your generosity, for allowing us to collaborate with you and to be with you here today. It has been wonderful. I am been laughing these days saying that we are voting that Barbados will always be the president of the group of experts. But Betty has not accepted this. So we will accept the vice presidency. And we have persons interested in vice presidency when we assume the presidency. Thank you so much, Betty, Troy, Alfred, Timothy, those of you who we've been working on many sessions to get here. So we now we'll assume the vice presidency in Chile. And I want to tell you some phrases by Violeta Parra so that you get to know about it. It has borders in the north with Chile, with Peru, with the Cabo de Horns. It's in the east in the Cordillera mountain range, and in the west, it's in the coast. But the most important thing, says Violeta, is that Chile has borders with injustice. And one thing that seems very important is to recognize that we live in a region that is extremely unequal, where the drugs have an impact on this inequality and it deepens that inequality. And therefore, we have a responsibility as states to make every single possible effort to create programs to reduce demand for drugs. These programs must be effective. They must reach the populations that we need to reach, and so that we can counteract the inequality in which we live. And I am going with the lessons that I've learned with the conviction that here we have capacity to collaborate and to work together so that these inequalities in which we live, at least we can counteract them with good policies and working with international cooperation in this moment. In a moment when there's so much conflict in the world, at least we are here embracing each other and recognizes we are a single body that has the capacity to advance. So I wish all of you, I'm looking forward to seeing you next year for the next group of meeting of experts. Thank you very much. Thank you so much, Francisca. Betty, over to you.
Let me start by thanking everybody for very, very kind words. And just to go into my little prepared spiel, I don't have much of a voice, but I hope you can still hear me. So this week we were confronted by unpleasant but necessary topics for discussion. The agenda was wide-ranging, articulating issues that are persuasive, and as our Minister of Home Affairs reminded us, we needed to be courageous enough to tackle this head-on with bold approaches. And I think coming out of the discussions, we indicated that if we weren't before, that we've made a commitment to be going forward. Throughout these past few days, I have to repeat what was said before. I've observed an appetite to meet in person, even with all our challenges in making that happen. I think you would agree that this kind of forum brings more benefits than just sharing knowledge. I think one participant indicated that it was about 5 years since she had seen other persons, and that says something. This kind of meeting in person provides a kind of human connectivity that is critical, as you said, Liz, for us who labor in this field. It offers opportunities for spontaneous exchanges and mingling. We cannot place a value on the nonverbal communication that happens, and which happened a few moments ago. I saw y'all looking at me, and you know why, right? Right. So I want to thank all of you who were able to make it in person, and hope that we were able to transmit electronically some of the warm, fuzzy, genuine appreciation that we felt here in the room. So I hope you were able to pick up on that as you joined online. As Liz said again, it is easy for us to have become daunted from the trauma of COVID, the reduction in funding, the seeming low prioritization of drug demand in societies that are battling with allocation of scarce resources. But I want seriously to recognize our collective efforts in keeping this flame alive. This week we heard about WISE, the school intervention program from St. Kitts, the success of the faith-based interventions in Latin America, and the exciting opportunity to have those in the Caribbean, English-speaking Caribbean. We got to hear firsthand the results of the vaping survey, the transformative discussion on trauma, and how we have not considered this and new ways to rethink our approaches. So a lot has been happening. And once we continue with our resolve, we can work and develop these topics some more, because we all have experiences that we can share which reflect monumental changes in our various countries. In some cases, the issues crept up slowly, almost unobtrusively on us. In others, there were warning signs, but somehow they were ignored. And in other cases, the issues just seemed to appear on us. But whatever the scenario, we face a task that seems insurmountable at this stage, but we will keep on. We will keep on. You know, there is a saying, a journey of 1,000 miles begins with one step. I know in drug demand, sometimes we get to step 999, and then we got to start over from step 1. Something happens. But we have to find ways to keep at it. So I was just playing around as people who are older tend to do when they can't sleep at night. And thinking, you know, all the time we think of the challenges and we come up with these little abbreviations. And so I said, what difference would it make if when we think of the challenges, we also think of the answer to those challenges with the same abbreviations? So I said, okay, we are always talking about new psychoactive substances. That is the challenge. So as we talk about new psychoactive substances, let's look at new programming systems as a response. Right, get it? Good. Right. Drug demand reduction programs, and we immediately employ a mindset of do what we can, develop what we do, replicate. Can we replicate it? Is it plugging the gap? You get my drift? Right, good. So good. So in short, we have to be innovative, in sync with technology, and be ready to navigate that thin line between holding values but remaining flexible enough to be relevant. In this regard, I want to thank first the entire team at CICAD. Your support has been unwavering. And even at the risk of being politically incorrect, I wish to say that I think I can say that I have seen changes in the organization and how it responds to states outside of the bigger states. And you are more willing to work with us and to respond to our needs where we are. And so for that, I just want to recognize that and thank you for that. I also want to thank, and of no less importance, you, the participants who made this session come alive by the questions you asked, the comments which will inform our further progress. And for those of you who were perhaps a little silent, we go back again, we observe the body language, the leanings, nodding our heads. Sometimes the quizzical look which said to me, probably we need to look at this in a different way. You know, and all of that is lost again with the online method of intervention, to the facilitators, moderators, presenters. I know when we were doing this agenda, some of you volunteered, and quite a few badges were voluntold. Thank you so very much. it worked out either way. And in crafting this agenda, I want to recognize Chile, who we had several meetings, and Chile always made sure that they were present for the vast majority of those meetings, and so they helped tailor this agenda, so thank you so much for doing that. We weren't left on our own at all. The Barbados Language Center, led by Mrs. Mosley Holder, and your team of interpreters, thank you, and take a bow. Yes. Over each day, I was speaking with Emena, and one day she said we had 60 online participants in the morning and another 40. It says to me that you were keeping them engaged, and the quality of the translation, you didn't lose them with the quality of the interpretation. So thank you so much. To the unsung heroes of meetings like this, stand and take a bow at the back, the technical team. Thank you so much. Thank you so much. I know this could not have been possible, and a lot of the times we don't see the long hours outside of the meetings, the headaches, they have to pull down, they have set up. But the technical team worked with us from the start, and we're able to deliver to make this a success. So thank you. To my team from the NCSA, and I put down here who always put up with me when I transform, because as Francisca said, when it's something serious, when it is work, it's a different person, and when we're joking around. But so I want to thank those of you who put your nose to the grindstone with me. And we work this mornings, evenings, weekends. When I called, when I wasn't available personally, those persons who stepped in and made sure that the effort kept moving along, I really want to thank you. So thank you, NCSA team, who are scattered around the room. Raise, thank you so much. At this juncture, Alfonso, if you could just put back on your camera for me again, I'd like to recognize you and the work that you have done. I want to say to you, Alfonso, from the time I met you, you were one person, detail-oriented and extremely patient. It's always easy for us to not know who Alfonso is when you're attending conferences, because you're always somewhere tucked away at the back of the room. But without Alfonso, a lot of the details, the planning, if anything goes wrong when we are at conferences, Alfonso is right there, always right there. Alfonso, I wish you good health, and we will miss you. We will miss you. I had your limbo ready for you last night. As we spoke about, and none of them came up to par. I was waiting for you. But Godspeed, Alfonso. I really appreciate everything you've done. And on behalf of the participants here, we've gone together a little tribute for you. So I'm going to ask Emena to take it for you. So we all got together. And we signed, put some signatures so that you can remember us. And for your moments of frustration, I'm sending you a little golf ball. You can do what you want with it, throw it or hit it. So there you go. There you go. So thank you. Before I close, participants, there's one other little thing I'd like to share with you. Is the tech team ready? The floor is yours.
Together. all who are coming from overseas. You cannot land in Barbados, attend the conference for 3 days in Barbados, and don't experience Barbados.
Chantel, stand and take a bow. And so at this juncture, I am going to hand over the reins almost. You can get ready to take up the reins. Thank you so much for your support during our presidency, and rest assured if there's anything we can help you with as you go forward as chair, please feel free to call on Barbados. Thank you, Elena. Thank you. Raise, you raise a chair. Hip hip. Raise a chair. Hip hip hip. There you go. You gotta raise it though. Seriously, you do. Yeah.
All right, let's stand. Let's stand and raise a cheer for an excellent 3 days together. I hope I can get it. McKay may be able to do this a little better for the. So it's hip hip. All right, thank you. Hip hip. Oh, that was a little half dead. So let's go again. You're giving it your all, almost Herbalites-ish. All right. Hip hip. Hip hip. Hip hip. All right, it was really good having you here in company. All the best, those who are going, do travel safely. But remember, Barbados is only a plane ride away or a Zoom link away. Please remember those who are departing, complete your forms at the back so that we can have transportation provided for you. But I do want some pictures, random pictures. So get your pictures and your last conversations as we close off today. Thank you, everybody. Thank you, thank you, thank you.